Okay, McCoy County Finance Committee meeting, October 7th, 9:06 a.m. Could you call the roll, Amanda?
Alt.
Here.
Bowers.
Here.
Curtis.
Yes.
Johnson.
Here.
Young.
Yes.
McTaggart.
Yes. Okay, we'll call the meeting to order. Do we have a motion to approve the agenda? Do we have a second? Second. All in favor? Aye. Motion carries. Do we have any public comments? Hearing none, we'll move to the discussion and action on the health insurance bids. So I think, oh, sorry. Okay, Moman Ray wanted to present here as part of this, so we'll hear from them first here.
Thank you. I'll talk in 3 seconds while Julie's handing these out. I'm Brian Loman from Loman Ray Insurance Group. We appreciate the opportunity this morning to be able to talk about healthcare. It's obviously at a sticking point in everyone's budget. Healthcare prices and trends continue to climb at an alarming rate. Loman Ray takes a different approach, the way that we look at group health insurance. We'll talk about some of the benefits that we have and some of the alternatives that we have to where you're at today with Health Alliance. So again, Julie Busing is here to talk about those here at Loman Ray today. So I just again thank you for the opportunity.
Okay. Thanks, everyone. What you have in your packet is just kind of a bullet point overview of why Loman Ray, but what we really want to go into, and I can go over that if you want, or you can read it. But what I really want to go through is page 2 in your packet. If you want to take a look at that. When we were comparing the insurance bids, of course you got had a guaranteed renewal rate from Health Alliance of 9.9%, which is great. 9.9%. The market is and it's great for budgeting purposes to know ahead of time which a renewal is going to be. But then we have Blue Cross Blue Shield bids that we took a look at and started comparing. And when we put them side by side, you currently have a $7,350 deductible 100% plan with Health Alliance. And Blue Cross quoted a plan that has a $2,900 single deductible, $5,800 family deductible 100% plan. This particular plan is a qualified high deductible plan, and what that means is that you don't have any co-pays for your office visits or co-pays for your prescription drugs. So everything goes towards the deductible. However, the deductible is significantly less than what the county currently has. So when you start looking at the reimbursement levels on the HRA that the county provides and looking at the rates are less, and that's what's highlighted in yellow there on your page. If you go to the second page, then this shows a breakdown of the page right behind that. No, I think you have the 2 pages together. There's a page. It should look like this. Look like this. I think it's stuck behind that. There you go, that page. The page you should be looking at. It shows the premiums side by side compared, broken down, employee, spouse, employee, children, and family. And then it shows what the full cost of each of those tiers broken down would be, which would be the actual billed amount to the county. So Health Alliance's current bill rates based on your current census, and then what the renewal would be effective December 1st. And then Blue Cross Blue Shield's overall billing, and that's the middle box. The very bottom box is the county portion, and that includes, would just include what the county pays towards the employee independent premiums. So, okay, so the employee and dependent premiums. So this would be the cost to them. So if you look at the highlighted column there, the Blue Cross Blue Shield column, it's a 4.4% overall increase to the current plan. But then at the bottom, there's an HRA illustration, and this is not perfect because I don't have the HRA utilization report if I had the actual report, I could do a full-scale analysis. But this is just kind of an estimation for illustrative purposes only. The Health Alliance, it shows that if you had since you have a different reimbursement levels for the police versus non-police, I wasn't, based on the census, didn't know exactly how many were police and how many were just non-police. So I based this illustration on if you reimbursed everyone based on them having $1,000 single and a $2,000 family, which I know you do $3,000 on a family, but this is just an example. So the Health Alliance, the employee only, what the exposure would be $361,950. And then for Blue Cross, it'd be only $108,300. And that's because your deductible is so much less. And then on the family side, you have $469,900, then $140,600 on the family side for Blue Cross Blue Shield, making your overall HRA exposure $331,850 on Health Alliance versus the Blue Cross Blue Shield plan of $248,900. Again, this is just an example. That would be your total exposure, but then you also have to look at, you don't spend the full amount of what your exposure is on the HRA. So again, for illustration purposes only, I said, okay, if you had 40% utilization on that HRA, that's what's highlighted in red. 40% utilization on the Health Alliance plan, your exposure would be $332,740. But on the Blue Cross plan, it would only be $99,560. So that's a really big savings. Does everybody understand the illustration and why there would be such a big savings on the HRA utilization?
We really feel that we want to shift that liability off of the county's shoulders and put that on Blue Cross's shoulders and lower that exposure for the county. So that's why we're recommending the HSA plan.
Now, one thing that to consider, and not knowing what your bargaining contracts are with all of your unions, maybe you have to have a copay for your office visits and your prescription drugs, and that's certainly something that needs to be taken into consideration. If you don't, this is an excellent plan. If you go to the second page, and we're not going to go through all these, but these are a few other options on Blue Cross Blue Shield that would be potential options for you. Option 3 would be the best compared to what your current plan is with Health Alliance. It has a $3,500 single deductible and a $10,500 family deductible with a maximum out-of-pocket of $5,500 single, $12,000 family, which is still decreasing your overall, it would be decreasing your overall HRA exposure, because right now you have $7,350 single, $14,700 family on the Health Alliance plan. In this particular plan, you would still have the $20 PCP copays and the $40 specialist copays. The emergency room copay would go down to $150, which right now it's $175. So that would be a benefit. And then the tiers for the prescription drugs are very similar to what you currently have on the Health Alliance plan. The specialty prescriptions are actual copays on the Blue Cross Blue Shield plan versus coinsurance on the Health Alliance plan. And then the rates for alternate number 3 is below there, and they are less than what your renewal is with Health Alliance. Okay, so that's just when we're looking at and evaluating your health insurance. Obviously, when we have the full scale of the information, we can put together a more focused analysis for the county. But this is just an example of part of what we would do. So as far as Loman Ray goes, there's information in our RFP. My personal experience, I worked for Health Alliance for 10.5 years. I actually serviced the county a number of years ago as the client consultant. We had a different agent at the time. I think it was Wells Fargo maybe, I'm not sure, but that was a number of years ago. I used to also service the city of Champaign, the city of Urbana, the city of Danville, and larger clients. And then, of course, we know that, if you read through our RFP, that Lowman Ray has the IERP program, which is the Illinois Educators Program, where we have 24 school districts in the self-insured group trust that Brian put together and we manage. And we have almost 3,000 lives in that particular trust. So we're very familiar. We have Iroquois County Schools as one of our clients right now. So we're very familiar with large clients and doing the analysis.
In closing, what we'd like to say is it's easy to really sit down and look at what plan design you ought to be on. I would strongly recommend taking a very hard look at the HSA 2900 option. We have a telemedicine app that I talked about earlier this summer, late spring. That telemedicine app pairs. We have 5,000 members at Lowman Ray that have that telemedicine app on their phone. We bring our team up here to train that, train the groups and do on-site trainings and lunch and learns. 70% of healthcare can be handled over a telemedicine app. Some of these carriers will tell you that they have waived the fee, the copay for telemedicine. As most of us over here on the insurance side of the room know, that they waive the $25 or $50 for that charge, but the plan picks up on the loss ratio what the true cost was, whether there's facility fees on that thing. But if there's the 125 or 150, whatever that cost is, it's going to be passed on the loss ratio. So we really want to prepare now, and with the things we can provide with the telemedicine app and with our nurse. We have a nurse that was a OSF for 28 years, and she goes through billing errors with clients. We were at a school district last week where she helped a lady, teacher there, save over $1,000 on a billing issue. We do that every week. It seems like we find billing issues. We help get into certain facilities for reduced cost in MRIs, for CAT scans, and several other things. We've also had for surgeries to where we get spot one-off deals. That's more on the self-funded side, but we can do that on the fully insured side as well. So we're probably it's the only agency in south of I-80 that has a nurse, full-time nurse in our office on hand with almost 30 years of experience. Our 30 school districts and counties that we manage, they find that very beneficial. Again, everything that we want to do to where we're setting up the plan designs and providing the support with our team, our nurse that we have on staff, our actuary that we have on staff, is to drive down that loss ratio so you're more competitive and at renewal time. So there's no magic to what we do or how we do it. Those are the tools that we have in place that other agencies don't have in place that we do to help the groups to drive down those loss ratios. And if you really look at that plan and how we can structure that, you're shifting the risk off the county's back on that HRA, and that's where your savings is. And there's a substantial amount of savings on that. So again, we appreciate your time. If you have any questions, we'd love to answer those. Yeah.
Okay, so I need caught up on this, but how seamless is this for the employees right now if we were to do a switch? Like the ones that are currently seeing physicians, are they all gonna be able to be switched over to this Blue Cross if that was the case?
No matter what plan you're gonna go to or what carrier you're gonna go to, you're gonna have some bumps in the road, and you'll have fewer bumps in the road with us. You may have something that basically what they would do, if somebody does get caught, there's gonna be coverage. Everything will be fine, but the sooner that they can contact Chris Elliott, who is our nurse, things will get transitioned very quickly. So I wouldn't let that be a big distraction. But there are, anytime you move from a carrier, there could be ID cards. Again, they have coverage, but they're got to be ID cards. They get it lost in the mail, or they give you a computer. Sometimes on the PBM side of things, just stuff has to get reran. And so it shouldn't be I wouldn't let that deter from switching.
Okay, so if somebody's currently, let's say somebody has a big health issue right now, and they're currently undergoing whatever their treatment might be, that would be picked up you're not going to say, oh, you can't see that position anymore, you'll have to switch over to this. That's my question.
If you are switching carriers, Health Alliance to Blue Cross, we would want to know right away who that particular person might be, and then work with Blue Cross. So effective December 1st and after, any claims that come in after that, get them set up ahead of time with Blue Cross and say they are currently in treatment, they are currently treating, they can't change there. And from there, then you work with the carrier to set up a plan so that they can continue their care with their current.
Continuation of care.
Right.
And then you guys, Health Alliance has been fabulous with us about coming in and sitting down with the employees and going through everything and answering questions. I mean, healthcare is a huge issue and people are scared when there's change. So would you guys guarantee that you do the same thing and there's no?
I think we're positioned much better with Nurse Chris. You can call any of our 23, 24 school districts and talk about the value that she has had for our members. I mean, she has helped. There's a shortage on pharmaceuticals right now. We've had people that couldn't get insulin, and they call her, and she finds the pharmacy that can get her the individual, happened to be her this time, with those medications. So we've seen things, and actually that was a Health Alliance group. We're Health Alliance's #1 self-funded. We're right at #1 on fully insured. We do a lot of business with Health Alliance. We do a lot of business with Blue Cross. Again, it comes down to the rates and plan designs and those type of things. But I would not let that hinder my decision in any way, shape, or form. We will take very good care of whoever's in those type of situations.
And they'll have one person that they would contact that would be their representative for the county.
With Lomond Ray, that would be me. With Blue Cross, we would have somebody assigned.
Okay, and my question then again would be, what's the turnover for that? Like, if we have somebody that has an emergency and they contact you, how long do you think it's gonna be before there's answers given and that's ironed out?
If it's during the week, we start working on it immediately. If they contact me on a Saturday or Sunday, I do check my emails and can help with that as quickly as possible.
Just like a ballpark though, I mean, are we talking,
Less than
Than
24 hours. We had an individual that was in our school district trust, and they were hiking up in Wisconsin, and they had an accident, severed a finger, and within an hour, the superintendent at Blue Ridge, feel free to call Hillary Stanford. She was extremely pleased with the results that we had. She got a hold of me. All of our clients have our cell phones. We got on the horn with Nurse Chris, we call her. And we had a facility up there that was treating it as in network for the individual that was out of network.
And I do give my cell phone out freely because, sometimes I am on the road, so I want people to be able to get a hold of me.
How does this, I guess, are there any fees independent of Blue Cross and stuff for you guys? I mean, so we pay all the premiums and do all that stuff. Is there any cost to the county in addition to that, or that's just
The
all?
only cost that you would have, so with the volume that we have, and we've got almost 35 municipalities in the school district. So with the volume, we have 10 people on our team. Most of them have worked for insurance carriers or for nursing, the nurse worked for OSF. So just with the volume that we have, we feel that it's important to have those services to take care of our clients. The only thing on top of this, we could work with BPC, and there's some things that I'd like to talk to you that we've seen that BPC has not done that are concerns for the county. That would be in a more private discussion and a deeper dive on how we've caught some mistakes in the HRA because we do some of our own HRA. We look at some of the claims data and we've caught some mistakes at BPC that they've made. But BPC could manage this through either Health Alliance as they are today or through Blue Cross. We also have another vendor, TECO, that kind of works more independently with us, that we can do a little bit deeper dive and that we've caught some things on through some audits that we've done on the HRA. Because again, everybody looks at the plan design and they pay out these HRA dollars. And if they're not accurate, then you're overpaying on these HRA sides. So again, we want to reduce on the reimbursement side because we feel where the savings is here with this group.
But there's no additional consulting fees coming from Loman Ray directly, if that's what you're
The only,
asking.
the only additional charge would be out of the savings in the HRA, we would recommend that the county would buy our telemedicine app. And it's independent, no matter whether you're with Health Alliance, Blue Cross, Aetna, it's a Loman Ray type telemedicine app. But again, we have 5,000 members. Our members love it. I just got a call from Vic Zimmerman, actually a text yesterday, and he said, man, my wife was sick, used the telemedicine app, got her medications over the phone. It was great.
And I know you told us that this summer, but what was that again, or how much?
Healthy as you. Healthy as you. Can I pick up my phone and I'll just show
Yeah,
it to you?
that's fine, but what was the cost though?
It's gonna we could probably get it around $6 or $7 a month. So you're looking at
Per
60
employee
or,
per month.
yeah, 72, 80.
And you can choose, you can set that up however you want. You can choose to only offer it to people on the health plan, or you can choose to offer it to all of your employees, regardless of whether or not they're on the health plan. The benefit of that is you're still, you may have an employee that's sick, they're not on the health plan, but if they have to leave their employer, to go to the doctor and sit in convenient care for an hour or two and to see a doctor, whereas they could have just called the telemedicine app right from their desk or right from their car if they're public works or police, and be triaged right there. The only time that they would be out is for the phone call and if they have to go pick up a prescription. So it does benefit you to have all of your employees. I know I'm not on Loman Ray's health plan, but Loman Ray offers this particular service to all employees, and I have kids away at college that have utilized this multiple times, which has saved me because they didn't walk into a convenient care out of network or wherever. So I've been really happy with it. I think it's a great tool.
So again, I just hit my app right here, and Treska Foreman, she does that for us. She handles our ancillaries in our telemedicine app. Click on the app, and I put my face in here, and it takes a picture of it. And you press the button, and the doctor literally calls you within 10 minutes. You just hit that. You can do a FaceTime. You can do an actual call, but they call you, and it doesn't run through insurance. So I've had sinus infections the last couple winters. I hit 50 and I'm falling apart. But you do you have sinus infection, you got the headache. It's just a hoop to get a prescription. And a lot of people are like, you can get a prescription just by seeing a doctor over the phone. And I'm like, yeah, it works. We have almost 1,500 calls a year with our members that use this app. If you don't go to convenient care and you use this free little app, you're saving anywhere from $300 to $400. And I spoke about facility fees earlier. You get out of the facility fees. This would be our app, Loman Ray's, and the county's app, as others use this that are clients of ours. And it doesn't matter what carrier you're with, you always have this app. We own it, not the health insurance company.
How many employees do we have, Joe?
Excuse me, right now we have 152, but that includes full-time and part-time.
So you would have to make a decision, and it's your decision, would you want to cover the people on the telemedicine app, because they're the ones that are affecting the health insurance rates. So do you want to cover just the people that are on the plan? You can do that. Or B, you can say, hey, we want to be a good employer, we want to cover the people on the plan, and we want to have access to the telemedicine app for the people that aren't on the plan. Because again, they're not taking off from work, they may come on the plan, but we can design it either way. You're looking at about, depending on how many people come on, they've got price breaks, but you're probably in the, I'm going to be on the ballpark of high, you're probably looking at 7 to 8. If we get to that 150, you're probably going to be a little bit lower than that.
I know that we've presented Blue Cross to you. They have a significant, they have a great plan. Any of these agents here can tell you, present these plans to you. We all have access to the plans. You already knew that Health Alliance was going to come in with a 9.9% budget, or a 9.9% renewal. And if you've already budgeted for that number and are prepared for that, then, we're not saying not to go with Health Alliance either. We're just presenting you with what the options and the potential savings could be to the county. It may be that next year, when you don't have a guaranteed renewal increase from Health Alliance, you really look at making the change if you don't want to disrupt your employees this year. But either way, we just wanted to show you the potential and make sure that you're fully informed. And either carrier, they're both great carriers.
You had a great question. Does anybody else have any other questions besides that?
I guess as far as Jill here could talk way more about this than I would know anything about, but I do know that currently Jill says it's pretty easy on her, and maybe I'm putting words in your mouth, Jill, but she doesn't do anything hardly with the insurance, and our current broker does the heavy lifting on that and does all the, there's not much work up for the county is what I'm getting at.
Yeah.
We provide the same service. We have 35 bookkeepers, administrators that we work with. Actually, this morning they're having a bookkeeper meeting for our school districts just to kind of go through things that they may have had challenges with, whether it's on the ancillaries, on the people are doing the updates on their systems and those type of things. So
Certainly, if you do choose Loman Ray, what I would want to do is sit down with Jill right away and figure out what her expectations are of everything and lay it out and go from there.
One question I had was, I emailed yesterday about the consulting fees. This is a charge of the county above the standard commission scale. Can you explain what the standard commission scale, what you mean by that?
It's the commission that each carrier pays.
Okay.
It's different for Health Alliance versus Blue Cross Blue Shield. And so they pay a commission directly to the agency for giving them business. And so that's, and honestly, I don't get involved in the commission side, so I don't know what the actual scale is for each carrier.
Sure.
But it's something that's already built into their numbers on both sides. It's not an additional cost on top of your rates.
Okay.
So basically, all of our services are included into that fee with Blue Cross Blue Shield. Except the telemedicine app. Any other questions? Well, the last thing I can just reemphasize is, if you've got an exposure up here versus down here, reduce that exposure when you can. It'll save you money. And then also, when you can put in the tools to offset the expenses, it's going to help you over a little time. Again, there's no magic to what we do. That's the way we work it, and that's what's worked for us in the past. So we appreciate letting us talk this morning. Thank you.
Thank you. Yeah. Yes. What do you think? We need I guess there's two things we need to do today. One is decide who the broker is, and two, which plan we're gonna go to so we can finalize the budget, or at least directionally. And I guess and Susie's here and stuff. I don't know if we have any more questions for them, or if anybody in the group has on that. I guess one thing that does stick out, Susie, is,
And Joey's here as well.
I'm sorry, yeah, okay, and I had met you, sorry, but was the consulting fee, and just how that differs from
We had the
Compass
consulting fee.
and Loman Ray.
Sure. We had the consulting fee because we didn't receive a commission with our rates with Health Alliance in the past. We took that out when we took you guys over in 2014.
Okay.
So that's why we had charged the consulting fee. Now, Blue Cross Blue Shield, they don't take that out, so their rates have the commission in that as well.
Okay,
And we have those plans as well. All the brokers have those quotes from Blue Cross Blue Shield.
okay. And I guess then, if the 9.9% Health Alliance guarantee thing is assumed,
Yes.
then you're not getting a commission on it, but they are getting a commission? I mean, I guess,
No, we have not been getting a commission on your Health Alliance in the
Right.
past.
okay. And, but I mean, So for this, if we chose to go with the 9.9%
Renewal.
renewal, there would be no commission on that either?
That
That
probably does
would.
include the commission, yes, and then we wouldn't do a consulting fee.
Okay. So I think that's important to understand, yes, okay. Because what I'm getting at is that if it didn't have the consulting fee in there, then, or if you're not getting it, why isn't the price lower on what?
Well, the 9.9 has that in there, so we would
Yeah,
remove the
okay.
consulting.
Yeah, okay. All right, I guess this,
And then we have Joey with Compass also,
okay,
if we had any questions for him.
yeah, do we have questions on Compass versus Homestar versus Loman Ray, or anything we need to clarify, Joe, or you obviously deal with this on a day-to-day basis more than what we do.
No, from what I understand, it works the same way for you, Joey, with Compass, is that there's no consulting fees, it's just based off of, the commission you would receive from the carriers. The only other question I had is, you had mentioned, and maybe you can refresh my memory, something to do with the 1095Cs.
Yeah, so like our value proposition would be our benefit admin system that we would provide the county. So we have a system, Bernie Portal, that we would give you complimentary, that would do the onboarding for you, Jill, as well as all the staff. Melissa, who unfortunately is on vacation, is my right hand, just like everybody has a right hand. She's my trusted teammate, but she couldn't be here. She's down in Branson today. But we would help onboard you, do all the training, but we would go to a digital platform in the future to go paperless for confidentiality reasons, protection for the employees and their members. But we wouldn't charge for the benefit admin system. It would also provide real-time COBRA administration at no cost, so we would actually, that would be a value-add service for the county. We wouldn't charge for any COBRA admin. The other thing that our benefit admin system will do is the 1095C reporting at no charge. So we'll take care of all the reporting, which is a requirement. So compliance is a big thing with health insurance that you got to look at when you evaluate brokers. So we'll take that off your shoulders.
What are we currently doing on that? You two do that? Any thoughts, John?
If you get past asking any of these brokers questions, you might want to have somebody in the room if you guys are gonna discuss pros and cons of one versus the other.
Okay. We got any other questions for the brokers here? And if not, we'll probably ask you guys just to step out here for a second and we'll have a discussion and thank you.
I'm so sorry, I missed all that.
Yeah.
No, it's a lot of information.
Yes.
I have an experience in this field. Prior to turning down the law, I was in a lot of the employer side of health insurance, customer service, so I had a lot of this. So if you have any questions, I'll be happy to try and field what I can sort through some of these muddy waters.
Yeah.
I also have a comment on Help Use You. I have used this platform. It's a fairly good platform in all its reality. Now, some of my information is outdated. It's about 4 years old now. It was a nice platform to be able to get those minor health conditions out of the way. Whether you got kids, you put them in front of the video, doctor or nurse can ask some questions, get some help, and go on about your life without having to take the 2-hour doctor visit, wait for medicine, and et cetera. So. And
I have a
probably
doctor
get
that uses that, and it
regardless.
is kind of nice for quick things.
Does it really work though? Because every time I've ever called those. They're always like, oh, yeah, you know, you might have strep throat. You should probably go see your provider.
You
and get
have to
tested."
fit in their list of options, what they will cover. If it goes anywhere near the line or outside of it, they will not touch it with a 10-foot pole, and you wasted about 10, 15 minutes.
And, yeah, $912 a year for.
So you have to work within the box, and that's probably gonna be the same no matter what telemedicine you're using.
Well, anyways, I guess the good thing about if, and Jill, you need to pipe up, because you and Amanda, yes, my brain is not working, deal with this a lot more on a day-to-day basis than what we do.
Yeah.
So Lomond Rate is from Danville.
Yeah.
They don't have an office here though, correct?
Yes, I do.
I'm asking.
Don't they have an office in First Trust?
Oh, well, I saw that sign there, but I didn't know if that was actually an office in
Is
there.
it new now?
What's that?
It's newer?
Well,
been there?
no, I think didn't they,
I just saw the
they had the
sign.
office in Sisseton. And I think the secretary who was in Sisseton lived in Sheldon, and now she works in the office in Watsika. She does. So when you walk into First Trust, you take a right, that's Longman right there.
Card says Danville.
Well, I think that's where they're based out of.
Yes, sir.
They're home, just like Susie with Homestar, she's based out of. One of those three. And then Compass, he's actually out of Bloomington, I remember. But he deals with Roger Schultz and Myron. I mean, personally, we've been pretty happy with Homestar. They have, it sounds like they're all three pretty competitive as far as what they're gonna offer service-wise. I personally like the fact that we're not trying to be upsold by Homestar, like with the telemedicine or with the admin app or whatever it may be. We currently do the 1095Cs. We've never really asked Susie if she has the capability of doing them, but they're not really that difficult to do. It's one time a year.
And I guess I should have asked on this side, Homestar, Susie, they do 1095Cs on their end, and then I do it on the employer end.
Mm-hmm.
So are they saying that they're doing, I wouldn't think they would do the employer end, because we do get one from the insurance company.
Yeah.
So if they're saying they're doing that, well, we're already having that done for us.
Yeah.
At no cost.
I'd take you guys' word for it more than anything, because to me, it seems like they're all providing the same thing, give or, you probably wouldn't notice much difference, other than if somebody's more responsive or whatever, and
Right.
I guess the problem with that right now is that until you do business with them, you'll never find that out, because it's yeah,
Just-
we'll do it
just
right
in
up
my
till they do or
experience.
don't, I mean, it's
Just in my experience, Homestar has a good relationship with our current employees as well as our retirees.
Yeah.
I don't have to do anything with our retirees. They handle everything
And that's a big thing
each year
for us.
with the retirees as far as their costs go. We send out letters to them, which I'm sure each of them would. But retirees don't even contact me. They contact Susie's office directly. If I have a question from Brian tells me, hey, I want to do this. I send Susie an email, it's done. Or Susie will, if I have a question, Susie will just contact Brian directly. I'm strictly the middleman, and I really don't have to do anything at all, besides maybe get a signature from an employee.
I guess, and my opinion is, or feeling is that they're all providing the same policies and they're all theoretically doing the same thing. So it almost becomes okay, are we unhappy with what we have? Because I guess you don't know, maybe somebody would provide better service, but it's kind of everybody's gonna say they're gonna provide better service, like, unless I don't know how you, I guess making a change to a different broker doesn't seem like, unless you're unhappy with the one you have, or think that this one, whatever they're gonna give me is gonna be that much better, I don't know that you're really gaining anything on our end of the thing, because the policies are all the same, no matter who you're using, but I guess. that's a simplistic way of looking at it, and I don't deal with them on a day-to-day basis or have a relationship with any of these people, so I don't know anything other than that. If they're all providing the same policy, and the people that are helping us now, or we feel like they're doing a damn good job, then why would you change it? But that maybe is the wrong way to look at it. You gonna say something, Sharon?
Well, I like that we would save money, but will we save money next year? You know, I didn't really get that opinion that it's not the potential for increases, et cetera. And I guess I kind of felt like my issue got skirted with the whole, if somebody's doing something right now, and all he said was, well, we'll help Nurse Chris, contact them, they'll work with them. That didn't really answer my question. And
Right.
not,
Well,
just
and I
put that
think
on a personal level right now, sometimes keeping your employee happy.
Yeah.
And not having them go through insurance
Craziness, yeah. Frustration.
nightmare is maybe sometimes worth that.
Right.
But I'm not saying that Blue Cross and Blue Shield isn't great. I don't know. But at the same time, are we gonna save enough money consecutively that it's worth the change? I don't know. That's all I've got going through my head right now.
Right. And understandably so. but I think, agree with what you're saying, but we got two decisions, right, to make. One is who actually provide, because all three of them can provide
Right.
Blue Cross Blue Shield, Health Alliance, and all the litany of different policies. So that's, I think first we almost, just to back up, we almost need to decide who's going to be the broker, and then your point on Blue Cross Blue Shield versus Home Alliance or Health Alliance and that stuff is kind of the second topic, which I think your points are valid. We need to consider that, but maybe we need to do one and then the other, or we can do the other way too. We can pick policy first and then do the broker. But
Could I offer a suggestion
Yes.
that you may review your medical plans first? Since you do have a little bit of differences in between them, and then you might make a decision as to which broker you're going to end up looking at. All the brokers are offering similar, yeah, we'll do this, and to your point, right up into. As far as Sherry and your comment, I'm going to guarantee you whenever you change a provider network, when you're in the middle of a health crisis, for lack of better words, whatever is going on in your life, you will have a bump in the road, and sometimes, to Sherry's point, it's gonna be rough. Utilizing the system to your best of your ability, utilizing those nurses when they're available to you will help. But if you already have this relationship with the doctor, nurses, etc., nothing's going to stop that. So especially moving a provider network, unless the network is exactly the same. So some doctors will contract with Blue Cross Blue Shield and Health Alliance. Some don't have contracts with either.
I think this is why, I mean, even in years past here, when we haven't been talking about brokers, is that we always end up going with the same plan, because this is the discussion that happens, and or we talk to the employees and stuff, and they're all like, don't mess with it, because they got their doctors and they know how it works and all those things. I'm not saying that's right, but obviously people don't like change as a general thing, and that's, I think, and for good reason in a lot of cases, because they don't want to have that headache. But that's why I think we've always been, since I've been on the board, we've always been with Health Alliance, because it was like, just keep doing what we're doing and keep everybody on the same thing. But
with Blue Cross, you're saving money upfront as the person with the insurance.
It depends on what plan you go with, but yeah, that's what I'm kind of.
Right.
1 year agreement, right?
Yeah, we renew insurance every year at budget time, yeah. And the difference between the Blue Cross Blue Shield quotes that were given by Lomond Ray just now versus Compass and with Homestar is Compass and Homestar, Blue Cross Blue Shield was here on the day that they were opening bids and presenting, and they recommended a different plan, which they highlighted in their book. Plan MIBPP 2170 versus the plan that was just, discussed with Loman Ray. So there's a little bit of a difference there as far as numbers go. But that's, I just wanted to explain why there was a difference. We actually had Blue Cross Blue Shield here last month that presented.
Okay. So was this the first time Loman Ray's been here then? Or-
Yeah. Yeah, they didn't present when we opened bids,
But they had bid.
but they had bid. They put in a bid, but they weren't here to present.
Do we know, like on this comparison you did, Jill, like, do you have anything similar? Probably the Loman Ray number's gotta be somewhat directional, but where they're comparing what the county's out of pocket, or, I mean, what our total cost is and what their,
Then this is the first time I've seen the Loman Ray, that sheet that they just presented today as well, but it should be the same, if I remember correctly, they quoted the 9% increase for Health Alliance, and then, but they quoted a different Blue Cross Blue Shield plan than what Blue Cross Blue Shield recommended to us.
Yeah, that Blue Cross Blue Shield is really that difference, what
Mm-hmm.
we kept talking about.
Mm-hmm. And then when Blue Cross Blue Shield was here last month, they highlighted in the book which one they recommended was comparable. So, I mean, that's another discussion, is if you want to go through the,
I mean, it just seems on the surface, and I think Sherry's points are valid, that we don't wanna make somebody's life hell, but it does seem like Blue Cross Blue Shield is cheaper, and there's at least a $25,000 credit on top of that I don't think is in these numbers they were showing. I don't know.
I think it was in the original packet that they're both gonna offer that 25,000 transition credit if we switched from Health Alliance to Blue Cross Blue Shield.
So is that from Blue Cross Blue Shield or the broker themselves?
That was from the Blue Cross Blue Shield. Yeah, yeah. So, I'm sorry.
So I assume that's in addition to the savings that they showed here. I mean, because there's no mention of it.
Yeah, I mean, I would assume so.
So Susie only gave us Health Alliance this time, she didn't give us,
No, she gave us Blue Cross Blue Shield.
she did give
That's
us.
what I'm saying. I think
Yeah, they
I
all
think
three quoted.
it's
Blue
all the
Cross Blue
same.
I got you,
It's just,
now I'm with you, I did.
that's why I
didn't
was
see that,
trying to
so-
say that earlier, is
Okay.
that like,
Got you.
we gotta pick a plan, but but it does, they're all three of them will provide the same plan, so it's not like, oh, it's the Blue Cross people or the Health Alliance people, and you gotta choose between them, they're all providing the same thing.
So did she offer any savings with her, I mean, which of the plans was better that she offered? On that?
They all offered the same, the 9.9% increase for Health Alliance on our current plan, or we can do an alternate option with Health Alliance that was at a 7.5 to 8% increase. Which the deductibles, the copays and all that, they're all higher, of course. And then Blue Cross Blue Shield, they all three offered Blue Cross Blue Shield, the recommended plan from Blue Cross Blue Shield. Now, like I said, with Loman Ray, they just presented a different plan with.
Right, gotcha.
Yeah, yeah, with Blue Cross Blue Shield. So as far as the brokers go, it's all the same, what they can offer as far as the insurance carriers. Now, for their individual services, the differences that I heard between them was, this one wants to promote Compass wants to promote the admin, I wrote it down. Yeah, the admin benefits app, and then Loman Ray wants to promote the telehealth, and then Susie's, obviously, we already know what they provide because we've had them for a while now, so. And Susie got us the 80,000 last year, from Health Alliance.
That's what I'm saying.
My personal opinion is, my personal opinion, and maybe I'm being soft on this, is to say with Susie, just because of the fact we already have a relationship with her and people seem to trust her and all of that kind of stuff. What policy we go with, I guess I'm kind of out in left field on right now, not having looked at all the numbers and the comparisons and all that kind of stuff.
And usually, each year we poll the employees with the different policies that are
Right.
presented to us. We didn't do it this year because we're bidding out brokers as well.
Okay, I got you.
I mean, it's usually overwhelming that they want to keep the same plan regardless.
Well, because everybody hates change.
Right.
Change is
It's hard
difficult.
enough to understand insurance and then to add change on top of it. I get it.
Well, and that was just my
Mine's
fear.
still married.
We heard it all.
He didn't hear it. I'm not married. I can change plans.
Just my fear that Nurse Chris wouldn't be readily available to answer a question and
For so many people.
first, yeah,
Well, and who knows? I guess that's why I was saying is that
Yeah.
if they're,
I know.
until you're unhappy,
Yeah, I get it.
it
I do
almost
like
seems like you're
second
just
one.
changing in the name of changing, unless one of those other benefits is, sounds, man, we can't live without the tele app, then, other than that, it sounds like they're all kind of providing the same thing, and if you're not, and you feel like they do a good job, why would you just say, nope, we don't like you anymore? You know, like, I don't know, it seems, just to see if the grass is greener on the other side.
Why don't we stay with it?
Well, I guess that's what
I mean, unless
that's
there's
kind of what I'm getting
unless
at, but I don't deal with it every day
$1
like
difference,
all
you know.
these people do. Right.
She's very, I mean, speaking from, the few years that I've been here, she's very easy to work with. She's very personable. She's always here. What's that?
She's not leaving.
No, and Brenna, if Susie's unavailable, Brenna's also very helpful and available and answers, very timely. The benefits fair every year, we basically agree on a date and they do all the work.
So there's something to that too, not giving you guys extra work. Not saying the other people wouldn't do that, but you feel that that's all, you know what that is. I mean,
Right.
but knowing it, I guess. What were you gonna say, Joe?
Well, I guess I think last year she came along with a 21% increase and it got us to thinking, hey, we need to be fair to the
It was stout
taxpayer.
last year.
I agree.
Right.
And I agree. The thing that I didn't realize is that there is no, no
Right,
offense.
you're
They're
doing-
competition, but they're all providing the exact same plan
Right.
for the exact same dollar amount.
But
It's
we're
like-
doing our due diligence.
Right, no, I
by-
agree. But I guess not having gone through that, trying to select the broker thing before, I would have thought the same thing, that, okay, well, we'll bring somebody
more
else in, they'll have a better price, but they're all representing the same two companies, so
Yeah.
it's, I guess, if we had Lone Ray or Compass, they would have brought the 21% increase too from Health Alliance, is the cold hard reality.
I just don't think, in my opinion, last year, I don't think it's fair to hammer on all the county officials and things to keep their budgets in line, and then they just come in and raise our health insurance
Agreed.
over $100,000, and we don't check them on it.
No, I agree.
Mhm.
That's-
So one other question I had is on these consulting fees then, did I just hear her correctly that if we went with Health Alliance, she's going to,
Waive those consulting fees because they're included in the 9.9.
okay.
I mean, that's.
That's what she said, so we need to make sure if that's what we decide to do,
Mm-hmm.
I agree. But do we have those baked into the budget right now, I assume? Okay, so there is.
What we have in the budget right now
20,000 or what?
is the 9% increase.
How much we got for the consulting stuff?
It's worked in with the increase. So it's already built in.
Okay,
I could take it out, but for now, it's already built in.
so there is a little bit of savings compared to what we had in there,
Right.
11,000 or something.
So I guess you would
I
just
would
need-
probably say given we've had a good history and there's no problems and you guys seem who deal with them and the employees, based on your word, I assume everybody agrees with that. Homestar's been fine to work with. That I would propose that we stay with Homestar as the broker.
Got a motion?
That's a motion. And I guess we can vote on that. Can we vote on that?
Homestar and Susie,
Homestar's Susie.
Yeah.
And we stay with them, and then we decide which plan we want after that.
So are you making that?
I'm making the motion that we stay with Homestar Insurance, or whatever they call themselves.
I'll second it.
You want to do a roll call
Uh,
or just a voice vote? Halt,
Yes.
Bowers,
Yes.
Curtis.
Yes.
Johnson,
Yes.
Young,
Yes.
McTaggart.
Yes. Okay. So that's one off the checklist, and then, now which plan?
You want to have Susie come back in and discuss the plan with her?
Maybe. Should we, okay, yeah, maybe we should have them.
What does that 9.9 versus 4%, what's that really come down to? Do you have any kind of an idea? I know there's a lot of different employees and things of that nature. What was our premium last year, 500?
Yeah, I get what you're getting at.
Yeah, I think even if we change plans for
It's an easier
money
transition.
issues, having the same broker that they're already familiar with
Might make that easier.
would make
if you
that
did switch
a much
plans. Yeah.
easier transition.
Right,
Because
right.
they've already got an established trust there, so to change,
Okay, so for the county's portion, it was 515,596, and for this fiscal year, for 22 fiscal year, it went to 586,680. So a matter of
60, 70?
So, yeah, average about 70 grand. And we have added a couple more employees, but we've also gotten rid of one or two, so we're right around that 145 to 150 mark for employees.
Well, maybe we should ask her about, that's, tell them thanks, and then we'll
We'll get
ask more questions about the actual policies with Susie. Okay.
Myron has to stick around for the.
Yeah, Myron, but Joey can leave, because he was doing all of that. Well, that was an easy one. It's the-
Well, thank you guys for coming in, and thanks for being a part of the whole process here. And just so you know, we voted on the broker when you're out there, and we're gonna stay with Homestar. And it's nothing, you guys all did a nice job presenting and all that stuff. It's just there's a lot of similarity there, as you well understand, and with similar products and things, and we've been happy with them, and there's, I guess, no reason to change until feel like we're not getting some aspects. So that's kind of where the decision came from. But we appreciate you.
We respect that. We
Yeah.
appreciate it.
We appreciate you guys taking the time to do all this. So,
Thank you for the opportunity.
yep. And Susie, we got some questions though about the policies. So, thank you guys.
Yep. Yes, have a great day.
Yeah.
Thank you for your time.
Thank you. Okay. All right. Walk us through I think we kind of understand we have option A is staying with
Yes,
what we
staying
have
with
in the
Health and Life.
9.9.
And then your other
Why
option-
don't we want to go to Blue Cross Blue Shield, and what's the other option?
No, Blue Cross is great. You
No, I
guys-
mean-
I mean, if you want to move to Blue Cross, it's an awesome network. It's a huge network, the PPO. Now I know when Blue Cross dropped off their proposal, they highlighted a different plan that was, than what Loman had just presented, Loman Ray. So any plan in that portfolio we can look at. Are you guys wanting to go to an HSA where there's no co-payments, or do you want to stay with a plan with co-payments?
we want 100% the best insurance
Yeah, I get
available
it.
for $1.20.
Okay, I'm on it.
And we want to save lots of money on our end.
Perfect.
But provide the best service for them.
Because we also can look at that $3,500, because the plan I showed, I mirrored what Blue Cross had given out when they dropped off their proposals, and that is the higher $5,000 deductible. It's still gonna save the county money on the HRA, but if we wanted to go to that $3,500, that saves even additional money on that HRA. The process too, depending, if you guys do wanna switch, if you stay with Health Alliance, there's no change needed. If we do go to Blue Cross Blue Shield, it's a census enrollment that we send through. There's no health questions or anything because our rates are our rates. We will meet with all the employees like we do and go over everything, go through the plan design itself, as well as all the extras that come with Blue Cross Blue Shield. If you were to go to them or, stay with Health Alliance, we go through all the extras with Health Alliance too. It's really how you guys want to structure that plan. I think what we had showed with the 5,000 was comparable to what you guys had in place now, and you are saving on your HRA. However, if you wanted to look at an even lower deductible, I can get that spreadsheeted and over to you guys today, showing the comparison from your current Health Alliance plan to that $3,500 deductible with those $20 copayment and $40 copayment. Now, a thing to think about. Health Alliance has the actual feed to BPC, so claims are automatically fed to BPC. Blue Cross Blue Shield does not have that feed to BPC, but they use Envision. Envision is the same, a TPA that does the HRA like that, and they have an automatic feed to Envision. So if we were gonna go with Blue Cross, I would also suggest we switch over our HRA portion to Envision to have that manual feed. Otherwise, it's gonna be up to those employees to turn that in. And they're so used to the manual feed that why not go with that with Envision if you're gonna do Blue Cross Blue Shield.
The other thing that I noticed between the two is the co-insurance. It's currently covered at 100%.
Right, and this is at 80%.
Or 60% out of network.
Right,
Correct?
right. 60% out of, but it is hard to go out of network with Blue Cross Blue Shield. Your
Yeah.
network is actually bigger with Blue Cross than Health Alliance. And the other thing, if you guys notice that Blue Cross is going to give you guys a one-time transitional credit of $25,000. Now, I know Health Alliance came back and said they would take 1% off if you wanted to go with their HR system as well, but that would just get you down to 8.9%. And I don't know what, if you really need that service at all through Health Alliance.
Yep.
With the HRA, what is the employee's responsibility going to be? Because like right now we have $1,000 up front. The actual deductible is $7,000, so the other $6,000 is paid by the HRA. What are we is it gonna be the similar?
We left it the same as the employee doing the 1,000 for the non-FOP and then 500 for FOP. But that can be changed at any time too if you guys want to do that. It's what you guys structure that at. They
Is
will.
there additional charges, like for example, if they wanted to go to your insurance is 100% covered, within conjunction with the HRA, is there additional fees that go along with that? Is there additional cost?
If you
other than
change,
the HRA amount?
there's the HRA fee, or the HRA per person amount that you pay, and then if you do make an amendment to like BPC, there would be a $150 fee to make that amendment, but Homestar would pick that up for you, for the county.
So if they did a larger deductible, so you said 5,000 was
Right.
one of the plans.
Right, that's what Blue Cross had
So
highlighted
if
as
the county
most.
decided that they wanted to 100% cover the benefits for them, there would be, is that a true high deductible health plan, so there's no co-pays or any of that?
No, this has co-payments. This one has the $5,000 plan does come with co-payments that I showed. We can look at higher deductible plans that don't have co-payments too. I don't know how you guys feel about that. I know a lot of people like that security of having a co-payment when they go to the provider, the doctor's office or a specialist, or when they go to get a prescription filled. When you go to the high deductible, it is all going to go towards your deductible, but if you restructure that with the savings to make that deductible lower for the member, that's also helpful too.
So there's a lot of opportunity.
There
for
is,
you.
and I can dig into this. Are you guys wanting to stay with Health Alliance, or do you want to move over to Blue Cross Blue Shield? Because what I can do then is, when I get back to the office, dig into all of it and put those plans together so you can kind of see them, Health Alliance, and then what we're looking at side by side.
Well, this is it. So that's what I'm gonna say.
Right.
I know we have to approve, we gotta get the budget pushed through here. But like, my view is, the worst case scenario is we do the 9.9, because we got that in there. And if we went to Blue Cross Blue Shield, it kind of looks like we're gonna save money, right?
Right.
So, okay. So if we pass the budget with the higher number in it, and then make a choice that, no, we're gonna go to Blue Cross Blue Shield or the other Health Alliance or whatever
Then
we
you're ahead of the
decide,
game.
we're still covered. So then the real question becomes, when do we have to have this done so that the re-enrollment and all that
Yep, so
stuff.
since we're
happens.
December first, we're gonna wanna
So
get on
like, we
it,
could
so.
do this like next month's meeting. we
Oh
could
my
like-
gosh, if we,
okay.
well, we
Like
need to know by
November.
then, because we're gonna wanna, in the past, we've done just a benefits fair, and you guys have had Health Alliance, so people just come through, the plan hasn't changed, everything's the same. With this changing, we wanna sit down with them. There's gonna be a lot of questions, we can send something out so you can do a, mailing to say, they're gonna be here at this time, here's the plan that is being offered for December first. Come with your questions, we're gonna have packets ready to go. And like I said, then it's basically, what we'll do now is we can extract all the information from Health Alliance and put it in the Blue Cross census, if you will, right? And then if anybody's making changes, like I'm adding a spouse, I'm taking a child off, things like that, we can make those changes into that census. It gets sent to Blue Cross Blue Shield. There is the paperwork that, master application that captures the county's information, the waiting periods, what you're contributing towards those premiums. But once we have that in, we should have an ID or group number, welcome letter back with a group number, and then we have access online that we can print ID cards, so everybody has a paper copy if they're not in their hands before December 1st.
All right, so what I'm getting at though is,
Can I ask a quick question? I couldn't find on Blue Cross Blue Shield, because Health Alliance, obviously the urgent care copay, that's a big deal. A lot of
Yeah.
people use that urgent care. How does that work with Blue Cross Blue
Blue
Shield?
Cross, right on this plan, it's subject to the deductible
Okay.
with that, so on the one I'm showing. So usually with Blue Cross on those, it's subject to that plan deductible. But you can also do the virtual visits if they're, those are so simple. I've done them, it's so simple. It's a regular primary care copayment with Blue Cross Blue Shield. You either do a video chat or a call over the phone, and if you're done within 15 minutes, not even. It's very simple. So that's easy. The urgent care, it's gonna go towards the deductible and be covered at 80%. But again, if they're meeting their deductible, then that's gonna be reimbursed through the HRA.
Is that prompt care, like IMH has now, considered urgent care, or is that considered an ER
Is it-
visit?
Well, if it's not in the hospital, it would be immediate care, like an urgent care copayment. If you're going to the ER, that becomes your ER copayment.
Well, in our local hospital, they have a
What they call
prompt care.
prompt care.
Then that's probably like your immediate care, which would be more of the, not the ER copayment, but we
Yeah, it
can
would
check
be.
too. I can reach out to them to see how they build that, but
I
I'm
just had
just,
experience with that. yeah.
Well, and that would be nice.
It's not an ER copayment.
No.
They charge you the urgent care.
Urgent care.
okay, perfect, thank you, Jill.
Yep, you're welcome.
You
And
run
are-
into challenges with a lot of these, especially when you're in the hospital setting. So a lot of times when you're in a hospital setting, the billing is you'll get your emergency room copay, which is what they're talking about, then you get a doctor's bill. So whenever you've got an immediate care or urgent care that's in a physical hospital setting, you have to ask a lot of questions to make sure you're not getting
Billed for a facility charge or anything like that.
getting that emergency room.
Right, so when you go to like the immediate care as a standalone facility, you should be paying that immediate care copayment or that benefit. Now, when you go to a hospital, we have seen before where even a doctor's office, if your doctor's office is in Riverside, there are some that if they're affiliated through Riverside, that not only are you paying that copayment, but you might get a facility charge for stepping into that facility and having a service
I
done.
just wanted to be clear.
That's why the virtual visits are really awesome if you can do them. Not everybody can. And of course, urgent care is gonna be less out of pocket than ER. But if your arm's falling off, things like that, you need to go to the ER.
Can,
Okay.
if you go back and work on this, I'm sorry.
No, you're
I
fine.
didn't mean to interrupt you.
You're
But can you work your magic on these copays?
Yes.
Just try with
Yeah.
Blue Cross and Blue Shield to
Yeah.
work the magic on the copays, because
We'll look at the, yeah,
I really feel like people are looking at that too, going, oh my gosh, we've changed and now I've got,
sure.
if we could make that
Absolutely.
more.
I'll put some options together, get
That'd be
those
great.
over to, I'll send them to you two, and
Yeah.
then we'll be good from there.
That'll be
Awesome.
fine, yeah.
So our next meeting is November 7th.
Mhm.
We made a final decision. Is that enough time to do all this stuff?
No, we're gonna need to know, if you guys can make a decision before December, I guess my question is this. I will let Blue Cross know that there's a pretty good chance we're coming over to Blue Cross. What do we need to do? But we do need time for them to implement you guys into their system and go through all their stuff. That could take maybe 2 weeks.
Right.
So that gets us to the 21st. And then, if you had a decision prior, if you knew for sure, yes, this is what we're doing, and you're just gonna announce it at the next meeting, if you could let me know ahead of time if that's able to be done, at least we can get the ball rolling and make sure we're good to go. We'll do all we can to have everything done. And as soon as you tell me, I can submit the paperwork, I guess is what I'm saying, but it could take 2 weeks to get our welcome letter, which brings us to the 21st, which still gives us 9 days before, 9 or 10 days before December 1st.
There's another option, Michael, you could, if she has her stuff done by next Tuesday, we can make a final decision at the board meeting.
There you go.
You can even have your.
I'll have it to you
meet
today,
At
yeah.
8 o'clock.
Good thinking.
Before the
Yeah.
board.
And are we happy then with Delta Dental, IMED, and Kansas City Life then for the rest? Yeah,
I'm just, I
Yeah.
mean, this is an option.
Yeah, that would probably.
that works. I'll have this over to you then today.
Let's do that. So, and then one thing, just to clarify, we're not, no commissions or whatever.
No, there'll be no
Consulting
consulting
fees,
fee
sorry,
going forward.
consulting.
Nope,
Okay.
nope.
Right
So
down the meeting.
just be the last one we have for the third quarter and fourth quarter, and then, or it won't even be a fourth quarter because it'll end 12/1, and then there'll be no consulting fees for
Okay.
12/1 on.
Very good.
Okay?
All right, well then let's plan on discussing it on Tuesday. Or
Picking a plan on
Can you
Tuesday.
have your stuff by next Tuesday?
Oh, I'm gonna get it to them today, tomorrow morning at the latest, but most likely today.
Sure.
Because I have the quote here and I just have to dig through it and go, because the plans are standard. They won't change anything, but I'll just look at different options with the co-payments to see what we can come up with.
I mean, we can make that decision on Tuesday.
that sounds good.
Perfect.
If you wanna run it through the committee, like I said, you could.
We'll just do it
Come
in the
in
board
early.
meeting. I don't- Everything always happens in the board meeting anyway, so we don't need a meeting before a meeting.
Okay. Well, I just want to say thank you. We're happy to stay as your broker and continue to work with you guys and partner.
Thanks.
Have a great
Okay,
day.
yep. All right. Now we move on to discussion and action on the property, casualty, and casualty insurance bids. So, Myron and
So the only brokers we had was Roger Schultz, Myron with Roger Schultz Insurance. And there are 2 carrier choices that were presented, one being Ballistic Knight, which is our current carrier, and then the other one being the Illinois Counties Risk Management Trust, the ICMRT carriers. Myron can probably discuss I did a short little comparison, but any questions you have, I'm sure Myron can answer. As he was the only broker that bid, I'm assuming you want to stay with Myron?
Yes. So, all right, Myron, which one do we want?
Okay,
What do you
so,
think?
I reviewed both of them. We've had a long-standing, so have you, relationship with Bliss, and they've done an exceptional job on claims. And Tim is wonderful, you all know that, and he's helped you guys a lot. We have had ICRMT for a while, and we've got business with them. And in comparing, ICRMT is a well-rounded company that tailors their company towards counties. And there's a reason they have 59 counties. They specialize in that. And I guess my outlook on it is the jail and the sheriff's departments on all counties are the hot topics right now. It's not going to get any better. And I think ICRMT is better equipped to handle that. And I think that, the prices are real similar, and the easy thing to do would just be to renew where you're at and maintain that relationship, which I understand that, but ICRMT, in my opinion, they hold a pretty strong hold on counties, and they do a really nice job on jails and helping with risk management on jails and the sheriff's department. There's lots of things offered. And then I wanted to let you know that I know Tim's been working on the policies and procedures and the handbooks. ICRMT, they will literally take your book, they will review it with their attorney, and they will help make the changes, and then they will give it back to you, and then you'll have the option of, we accept this or not. So they have similar services. They have free legal, for them. If you call them, instead of using your attorney and paying you can use some legal advice up with them guys. If it was my decision, I like them both. I just think ICRMT is more well-rounded to handle counties. They handle Kankakee County, and I've talked to them, and they're happy with them. And they have a strong relationship with UCCI, right, John? So the fact that they waive your fee is great, but the fact that they're, they're really tight with them, and they know what's going on with the counties, I think is an advantage on their end. And that's where I stand on it.
Okay.
Premiums are similar, and as I said before, and they spoke in the meeting, ICRMT, if you decide to go with them, would do a full evaluation of all your buildings. Could it be a little bit more on premium? Maybe. They're pretty close right now, but that's a free evaluation. It takes a lot of time and money to do that, and they don't charge anything to do that, and then you know that you're gonna be properly insured on that as well. And they do things differently in that way, so.
What does a full evaluation of our buildings mean?
It means they're gonna do a cost replacement estimator. So like this building in particular, let's say it's $2.5 million right now, then they're going to look at that and what does it cost to reconstruct this building from new? And then they'll put that cost on it, and then should anything happen to that, then that's the guaranteed place that they're gonna have.
It has nothing to do with parts that make the ADA non-compliant.
No, it's basically just trying to get you to make sure that you don't have like a co-payment on partial losses. And right now, if you decide to go that route, before they do the cost replacement and the upgrade, they would do 125% cost replacement. So you wouldn't be subject to any co-payment there until they get all the replacement estimators done.
Okay. Well, I guess, anybody have any more questions? Otherwise,
That won't affect our current claims.
No. No.
I guess I'd make a motion that we accept the Illinois Counties Risk Management Trust bid. We have a second.
Sure.
Sherry. Okay, get her back on the meeting minutes here. Any discussion? Oh, okay, well, I guess maybe I should first.
Let's finish this one first.
Okay. We have a motion to accept the Illinois Counties Risk Management Trust bid, or
Yes.
the bid, okay. And a second, do we have any discussion on that? And I guess call the roll.
Alt.
Yes.
Bowers.
Yes.
Curtis.
Yes.
Johnson.
Yes.
Young.
Yes.
McTaggart.
Yes. And then I'll make a motion to accept Roger Schultz Insurance Agency as our broker. Probably did those in the reverse order, but do we have a second? Joe? Call the roll.
Alt.
Yes.
Bowers.
Yes.
Curtis.
Yes.
Johnson.
Yes.
Young.
Yes.
McTaggart.
Yes. All right. Very good. Any other insurance stuff we got to worry about?
Nothing that I have.
Okay.
Unless you guys have something, give me a call.
Okay, very
All right,
good. Thank
all.
you.
Appreciate it.
All right, department head reports. Kurt?
As I said, Bob, the tax one, we're sent out certified letters, collect the last taxes for the 22nd, October 25th. Gonna have a tax sale, and then after that, we'll have our last tax distribution in November.
Good. Brianne?
We finally, yesterday, received our grant amounts or awards for 2022. So voter registration grant, we are going to receive, well, as long as we spend the money, $24,547. And then for our election securities HAPA grant, we were awarded $12,998, and those monies can be put towards the .gov requirements from Public Act 10215. So what Michael's been working on getting us switched over to the .gov website and .gov email addresses for the clerk employees that all will be able to be, well, hopefully all will be able to be covered by the grant. And then one more thing,
On Tuesday, I received a proposal for some microfilm document storage fees. And so I did ask Jill to increase my recorder's automation expense another 15,000, which won't really affect the budget because that's just money that's in that account that I'm gonna use for its purpose.
Yep. Very good. Okay. We'll do Eric, because I think the sheriff's got more stuff. Or you guys might be competing for time.
I don't know if I want to be top dog on that one yet. Before you, I distributed the ETSD capital improvement plan. It's unfortunate, Michael, you were there at our last meeting, that our phone system may not be next gen 911 compliant, which we found out it is not. There's a lot of changes. I know we had originally, when the current system was purchased, it was expected to be next gen 911 compliant. There's still some more research to find out exactly why and what it is, but right now the case in point is the ETSB does now need to purchase a new next gen compliant system. Now, at the moment, the ETSB is currently going down the direction of, we are going to do an RFP for that. But because we were also investigating the CAD Jail RMS product as well, we may also be doing an RFP to include those. The idea behind it is since we've already been going down this path, there is a possibility that the ETSB could see additional cost savings by purchasing more products. We will not find that out until around Q3 when we start the RFP process for all of this. Now, this puts us in a position when we get into budget, and you tell me if you want to discuss this under the budget heading or if you want me to just leap into it now.
That's fine, go for it.
Okay. So we're going to be looking about the 200,000 mark for a next gen call system. And public safety software suite, I did get an updated number for Central Square, but because of the situation that we're being put in, right now my recommendation is to the ETSB is let's take another look at these other vendors. Central Square is right now, because of the phone system situation, we're kind of getting left out in the cold holding the bag. They have this new product that's available. But our current product, which was stated to be next gen, there's a challenge there. What are you going to do? We are coming at them with a point of leverage in here to see what we're going to go down, how that path is going to go. I do not know yet. There's a lot of discussion to be had with that, but Central Square at the moment is like, yes, I understand that you have this new product. The fact of the matter is we were promised, at least at one point, our current product was supposed to be next gen compliant, so what happened?
Right.
So I'm trying to get more answers on that one so we can figure out which direction the ETSB is going to go. Again, either way, we still have to buy a new phone system.
All right, that, you said you wouldn't get the quotes until Q3 of next year?
Right, so that's going to put us perfectly into FY23 budget discussion.
All right, that's what I was getting to. Okay.
And the ETSB right now, my current set direction when we get to the RFP is we may select one or combination thereof depending on what there is, because some vendors can do CAD Jail, but they don't do phones. Some vendors do both. So we're going to have a lot coming at us all at one time, but we're at least prepared for it. Specifically when the next gen system has to be installed, I need to get some more research on that. They're not talking moving that until Q2, at least the starting of that. So it could be towards the end of the year where they're wanting to do it. It could be 2 or 3 years. I need to ask a lot more questions, and I don't think they know where they're going to head yet.
Very good.
Also, I have a new hire that has started on her own in the rotation, so that's good news for money coming out the door for overtime. There's still going to be plenty of overtime because I've got plenty of people with plenty of vacation and compensatory time, so you're going to see those coming out. And I think this other sheet that I've distributed probably is gonna be best talked to
Okay.
under your budget.
Very good. All right, Sheriff. Looks like Gilman is the topic.
This is my first meeting, so I'm just kind of getting my feet wet on what you guys want to know and hear and how this works. So we did receive the reimbursement check for the correctional officers that went to the academy, the 2 COs. $6,460 was the refund, and that goes back into the refund account. So that came out of our training, and then that refund is I did attend the Sheriff's Association Summer Training Conference, September 19th to the 21st. Very good conference, able to meet with a lot of good sheriffs. Sheriff Downey, who actually hired me in '97, sat next to him, and he was a very, very good resource. Arrests and intakes in the jail, we had 45. Current jail population is 18. We did have a new hire that started on 10/1. He basically replaced my position. We have been in contract talks with Gilman PD. The chairman's been at the last, I think, 3 meetings. There was a proposal on the extra equipment that Gilman has. That was one of the attachments. We agreed on a price of $34,000 for all of their equipment, which is everything that we would be able to incorporate into our current service vehicles. That includes 2018 Ford Explorer with 25,000 miles. So all in all, it's a good deal. They could probably take that Ford Explorer and get 34,000 out of it today. So I would propose that we purchase those items. As far as the contract, do you guys have a copy of that contract?
Yes.
Jill, do you have a copy?
But we need to talk about this first.
The purchase of equipment is a separate
Right.
deal.
Sheriff, we'll deal with this, the kidney equipment here real quick. So I guess, how do we deal with that in the budget bill or?
Well, we don't have any money set aside in the budget specifically for this purpose, so.
Right, we use a contingency or?
If we have contingency money available sufficient for it, otherwise we'll have to open the budget up, I guess, and appropriate it.
Jill, do we have the contingency available to pay for this 34,000 in this year's budget? For the,
We do, yeah, in the county board contingency line, we do.
I assume we should.
I
we
mean,
just do
otherwise
that.
it could come out of public safety. too,
Yeah,
if you
otherwise
wanted
it's
to.
public safety.
So we can decide which fund right now.
Well, can we credit Gilman? Use it as a credit for them?
No, the cleanest way is to make it 2 separate transactions. And that's what they want, and that's what I conveyed to them as well.
Yeah, I would suggest we take it out of public safety along with all the other leasing options. I know it's only a month, but we have a month left to go before, and something else could arise.
Okay, I'll make a motion that we buy the proposed Gilman Police Department surplus equipment and vehicle through the public safety fund.
It's everything on that page.
Yeah, well, everything, yeah. For $34,000. We have a second. Ernie?
Sherry, did you second?
Sherry did.
I didn't think that sounded like Ernie.
Oh, he raised his hand. I saw him raise his hand. Any other discussion about it?
Yeah, I have.
Yes.
You don't have a contract in place yet for this. If you didn't have a contract, what would happen to it?
You got a good point. Maybe we should do
I
the other
think
one
that's why
first.
it's a separate deal.
We can put that in the motion, pending the contract signature.
approval.
Actually, those are items that we would just incorporate into our daily, structure at the office. So, the computers, the shotguns, the tasers, the vehicle, we would incorporate that into our fleet. And as a cost savings, I mean, that's a heck of a deal. So they're offering that. They said they're not going to have a police department either which way. They're going to disband their police department. So whether they go with the county or they just use our services for free, they're ready to disband that. So
In other words, we have use for it even if we don't have this contract in order.
definitely. But if we go ahead with the contract, that will assist us because we will need an extra vehicle.
We
So-
buy it anyway. you say.
Yep, that's correct.
And that's quite a difference.
Good points though, Charlie. Excuse me. Any other comments? If not, we'll take the roll call.
Paul,
Yes.
Bowers, Curtis,
Yes.
Johnson, Young,
Yes.
McTaggart.
Yes. Okay.
A little bit in your back seat, I guess. A little bit in your back seat, I guess.
Yeah, we'll get it all over here, get it going.
Okay, and then the contract. So
So the contract with Gilman, they're asking for a 40-hour work week, which our deputies work 4 10-hour shifts. Do you guys want to get into the details of the contract, or like how deep do you guys want to get into it?
this looks fairly familiar to the one you were talking about a while back. I mean, minus the ANARGA involvement, but it's fairly.
Right, the clauses that are in there's some differences, but they're very minor.
So one thing, Clint, like, how far are you gonna be able to go? I just wanna make that clear away from Gilman.
The mayor said he really didn't care.
That's still the game.
Yeah, he's not setting a certain radius. You know, if we have an emergency call or an accident or something in Milford, I would not expect for the Gilman contract cars to do that. If we have a shooting, an officer-involved shooting in Milford, I would probably expect that officer to respond. As far as the duties, it's gonna be normal patrols. We're not gonna do anything with ordinances. The only thing we would do is tow vehicles, which we've assisted them since they haven't had a police department doing that already.
And the assistance with towing is not doing the towing, it's in case the owner doesn't want the vehicle towed, you're gonna protect the tow operator.
Correct, yeah. We stand by for the tow operator to protect them, make sure, you know, if it's a ordinance violation, then they've gotta get that vehicle out, so. Yeah, we wanted to make sure that, we were not going to be writing citations for grass clippings and the gutters and that type of stuff. As far as the money, the initial cost was, for Gelman paying 85%, or $70,789, and the county's portion was $12,493. That includes the salary, and that's of a 3-year deputy, so we're covered. If this contract goes 2 or 3 years, we got a little bit of a cushion there. That covers the uniform, vehicle insurance, fuel, and maintenance on that vehicle. Chairman Schur had brought up that doesn't include the actual vehicle. His figures ended up saying like 50 miles per day, the squad car use in Gilman. 32.8 cents per mile. That would be an increase to Gilman of $34.11 and an increase to the county's portion of $602. So that was brought up at our last meeting. Gilman really didn't want to go over that 70,000 mark, but they did understand that. So we did have some more discussion. They were going to bring that to their board and their police committee meeting again to see if they could get them to come on board with that increased cost. So the current increased cost with Yeoman, with the vehicle is $74,200. The county's portion for that deputy would be $13,095, which we're adding an employee, we're adding a sheriff's deputy, and the county's portion is only $14,000. I think that's an amazing savings. I think that's going to definitely benefit our department and the county as a whole. The whole point of the public safety tax when that was passed was to increase the amount of officers, or that's how it was billed to the taxpayers. And I stand firm on that. And I think that if this contract goes through, Narga will be soon to follow, on with possibly Clifton, Ashland. I know they've been talking in Buckley about doing that. They got rid of their police officer. If that does happen, the only problem I'll have is finding people to fill those spots. We're bare bones on our shifts right now. We've only got 2 deputies on right now. We've got a juvenile transport. We've got one going out to the hospital today. So we're scrambling for people. So I think this type of a contract would definitely be a benefit to the sheriff's department, the county, as a whole.
Very good. Okay, so do we need to wait until they agree to this number, or I guess?
Well, if the finance committee approves it today, it goes to the full board on Tuesday for final approval. Gilman City Council meets Monday night.
Okay.
So I don't know if we'll know.
We can approve it, and hopefully they agree, and that'll be the end.
That'll be if we approve it and they approve it at their board, then it could definitely be approved at the full county board meeting. Correct?
Okay.
We probably won't know Tuesday morning what the results of their meeting was.
Well, is their meeting Monday? I'm sure we will. I'm sure they'll.
You gotta have an undercover agent down there.
Well, the reason I say that is because I volunteered to come to the meeting in case they have any questions, and the mayor said, well, you probably don't need to do that. He says, I'll call you if I think you ought to come, so.
I live about 2.5 miles
Right now, I'm
from
not
City Hall,
going.
so
Okay.
But
I'll have it.
We'll figure it out. Yep, okay. Then I'd make a motion that we accept, so we're gonna put the money in the public safety budget? Is that what we're saying?
Take the money.
Take the money from the public safety budget, our portion? Is that what we're proposing?
That would be the best for the FY22, as the salaries have already been worked into the general fund. And, that we're still in the black a little bit, but not 13,000.
Okay. So I would propose that, I don't know if we have to do that all in one, but we accept the proposed contract with Gilman for the police law enforcement services agreement between the County of Iroquois and the City of Gilman and the Sheriff of Iroquois County, and pay for it out of the public safety fund for fiscal year 2022.
Second.
And the way this probably is gonna work is that Gil will establish a separate account. Gilman will be paying quarterly, beginning at the quarter. And the county's part can be brought in, but we also wanna be keeping track of all the expenses associated with this, so that if the contract nears its expiration, that a year from now, then we can.
So we need to have a general fund account with all the related expenses there, and then the public safety will transfer money in.
Well,
and the
not
city
necessarily
will-
an account, but a separate line item
Or
on the
separate,
sheriff's
yeah.
budget, and then as well on the revenue end, it would be a separate
We
line
have to-
item showing
We need to account for everything.
similar to the joint dispatch contract and how that works.
Right, but we have to account for everything as accurately as we possibly can.
Yep.
Another thing that's not in the contract at the present time that I'm not sure what we want to do as far as establishing a date for the beginning of the contract. Sheriff Hagan was the one that
The
put
first
this
day of
together.
December 2021.
Well, he he put the 1st of December, if that's what we want. I'm not sure that, we didn't talk about that at the meeting with Gilman.
If they wanted that. And it'll take me a little bit of time to get, you know, that person, scheduled and the schedule figured out how we're gonna do that. I think we could probably get it done by December 1. I don't think that'll be an issue.
Okay, so I mean, that should be part,
That works well with the budget year too.
right, that should be part of our, from our end of it, you know, we want it to begin on December 1.
That deputy will work there only and nobody will, I mean, besides vacations and things, you won't rotate.
You can put
We're
anybody
figuring
there you
that
want.
out as far as how we're going to do this. There may be one deputy that says, hey, I'll take that Gilman contract car. And he may be interested in doing that. I've worked Gilman, I've worked Clifton, I've worked with Sika, you know, just part-time. You're in a box, I don't like being in a box. But, you know, some guys like that. So, yeah, we can rotate deputies, the hours can change, they can be flexed. They want somebody there 40 hours a week. They're really not, you know, concerned with what it is, but we're flexible with them.
It's the way the contract is written, it's entirely at the discretion of the sheriff as to which deputy is assigned.
Okay.
I mean, it's our assumption that it would be one of the newer deputies, I think, from a cost standpoint, and as well as the nature of the whole proposition or situation, but he has full, you know, that's his discretion what he wants to do.
And it might change once you get in there.
Okay, so we have a motion and a second. Charlie, you got a comment?
I got some questions.
Yes.
We're being hit with a 4-page contract. In 15 minutes, we have to pass it. I think we ought to have some time, like, I see it's a 1-year contract. I see in there that it can be nullified in 90 days by either party. Now, I haven't had a chance to really study this. No one else in the room, I don't, has had a chance to study this. No offense to you. I mean, you brought it up and it's fine. I think this is a major change when we're going through an election year. Well, you say elections won't be over December 1 of next year. We won't be into the new year yet. We will in the county board, but new people won't take over until then. And no, until after the general election, but that really doesn't count in us because it's probably who's on winning the primaries will be on our board. But I don't feel election year is a time to go into something as deep as this. The sheriff is new here. I'm all for you. I know you are going to do a good job. But I think in his first year, he's going to find some things different being the boss than he was. Man, go to boss.
This was started way before I came on. Initially, it was Gelman and Anarga.
Yeah, I understand it.
We're
I
interested in
understand.
that. Sheriff Hagan was along with this ride up until the end of September. He's the one that proposed all the different things in the contract. Jim Scher's been with us the whole ride. I think it's a good thing for the county and for the government.
I don't mean disrespect for you. In fact, I think I'm thinking for you. You need a year, and anybody would.
Sure.
Because you got men that's going to be looking at you differently tomorrow, or already are, than they did the day before. And there's a lot of different things happen in running a police force than just being part of it.
Well, I do believe that this is the contract that we've been talking about for a while now. The only thing that's been changing
Okay.
is the numbers.
This is first got here. I don't study it until I get the thing in hand. What happens if this thing is dissolved in 90 days? What is the settlement in the car? Where does it go? What is the things like that? I know you can't say for sure, but you could wind up at least such a situation how to dissolve this thing. And that's a minor one.
Well, Didn't we talk about that before?
I think
though?
we've been talking about it for 2 years.
Well, no, I'm simplifying, probably oversimplifying, but didn't we talk about that before that, because I was the big proponent? If it collapses, out of that deal, we'll have new equipment, basically that we got at a very good rate, no harm, no foul, and if the budget can't support another officer, then we look at early retirements or terminations. That's what we had said before, correct? That was way back. So I think with a 1-year contract, we're pretty safe with that at this point in time. I see your concern, but I think that we'd all been in agreement that that was what was gonna happen.
I don't think I have ever heard of that as an agreement or even a plan, quite frankly.
Well, that was,
I mean, I got a short memory. I'm not
no,
getting to be an
but
old
you know
man.
what? The other thing was, that might have been when you were going through your bad,
COVID?
yeah, your stuff. So we might have, because I was still here and I do remember that we had kind of hashed that because I was very concerned about if we hired somebody in, because I just don't like to pull the rug out from underneath somebody and terminate. But we had talked about early retirements. We had talked about, in the end, if push came to shove, we would have to eliminate somebody if that's what happened. So
I know it's not easy to eliminate someone.
no, and I agree.
I was
but-
here the last turnaround in administrations 10 years ago. We had to reduce staff and police force at that time.
Right.
We had county board people that are crying. I know it's not that many, but one will create a very upset
No,
board.
and I agree, and that's why I brought it up. before.
That's why I feel it can be all done in the next fiscal year when the total people put it in place, have everything at stake at it while it's going on.
I see your concerns, but I also,
It could wait. I mean, we haven't had a change in the department for how long? Now we set up to make this bigger one right during an election. That makes sense.
We've been talking about it for 2 years, Charlie.
Talk was back at one time on the 2-part deal. We had talked before about just hiring 2 guys that were gonna take over for every town. All that was done was talked about and hired. There's 2 men out there. Why couldn't it be one of those men that take this position?
Oh, was it May 2nd, right?
so yeah, we just.
All right, well, regardless, we have a motion and a second. And if there's further discussion, yeah, go ahead.
There's nothing in here about the overtime, the amount of cost for the overtime. I didn't see it.
Did you address that? John?
Time and a half.
Any overtime incurred by the deputy sheriff provided contractual law enforcement services to the city shall be billed to the city at the deputy sheriff's overtime rate.
Oh, okay, I'm sorry.
Number 9.
So we had a figure in there.
No, because we talked about that too, when we talked about it before
Right.
for court and
Yeah.
stuff like that, so.
And there will be, you know, a few extras like that, and Gilman was fine with it. They were understandable. You know, this just can't be a flat fee that, you know, the officer, if he writes a ticket or if it was a domestic at 1:58 in the morning and his shift is supposed to end at 2, you know, he's gonna be staying on to cover that.
Gotta go. Something gotta go. Work it out.
Any other questions or comments, or? I think it is, I'll state it again, but what Sherry and I guess even that is that I think everyone, and we need to write it down in the meeting minutes, but that was something we talked about, that if we're gonna hire somebody new, and for some reason, and hopefully it wouldn't, if Gilman decides a year from now that, nope, we don't like that anymore, it's very likely or real consequence is that that we might have to go back down a person. I mean, obviously we'll have to deal with those situations at that time and reevaluate and all those kind of things. But obviously the whole notion of this idea from its founding, whenever we started talking about it, was that we were going to increase the police presence, as you pointed out, Clinton, and and hopefully it wouldn't cost the county too much, was the whole concept of this, that, okay, it benefits the city of Gilman, it benefits the county, and we increase the numbers, and it's a net not very expensive to the taxpayer. But that being said, if it falls apart, then we might have to reevaluate that.
Well, and at this time, it would be a good time to try, you have to put something in motion to try it, and it is only a 1-year contract, and, you know, the situation with one of your officers being on, being off for disability purposes, you know, who knows, in a year this may work out, and that officer we can just keep on in lieu of that person who's been out for a while, so. At some point, you gotta quit kicking the can and give it a whirl.
I agree.
She just reiterated, it's a 1-year contract, so at the end of the year, we can all change our minds.
Agreed. I just think it is a valid point, though, that, yeah, this could, just so, obviously, none of us want that to happen, but if something falls apart, we may have to make decisions we didn't want to have to make, but that's
Should be
a
amazing, and
realistic
everybody will
possibility.
love it.
And it could be really good, like you said. Maybe we do Clifton and we do.
I like it.
I hope it is.
Neither party can change their mind with 90 days notice to the other.
I think it's.
One of the reasons for a 1-year contract is because at the end of that 1
That's a
year,
rule on it.
Gilman may want to expand and have 80 hours of coverage, or they may want to only have 30 hours of coverage, or there may be some other clauses in there that need to be changed. That was the reason for the 1-year deal.
Right.
It could have been a 20-year deal, with a 90-day cancellation clause. You're still only obligating yourself really for 90 days.
Right.
So, I mean, we have to, but, you know, like I said, the idea for the 1-year contract is so that both parties have a chance to get their feet wet and determine if there are any changes that need to be made. If there aren't, then we can move forward.
Okay.
To me, that makes a lot of sense. There's obviously risks involved for both parties, financially and probably otherwise, but you can't do anything without, you know, some risk.
Okay. Is there any other discussion on this? If there's no other discussion, I'll have Amanda call the roll call.
Thank you, I'm sorry. Did that fall out? You see it?
You turn, heard it land. Turn.
We're gonna call the roll call on the vote, so you're.
Alt,
Nay.
Bowers,
Yes.
Curtis.
Yes.
Johnson.
Yes.
Young,
Yes.
McTaggart.
Yes. Motion carries.
Thank you
Thank
very
you,
much.
Sheriff. Yep. And then, now we're on to the budget. I think I've lost my paper. We had too many quick meetings there a couple months in a row. Now we're really pumping this one out.
Sure, blame it on me. Here. I'll give
You weren't
you
here
a paper
last
copy.
time.
All right. Okay.
Couple of meetings.
All
Wasn't fast, was it?
right, yes, discussion and action on fiscal year 22 budget. All right, Joe, give us a summary here. We're balanced,
Should pull up my own copy. Okay, so for right now, I just did a summary sheet on the front to kind of go over a few things. And I emailed it out and brought a few paper copies if you guys need to share. The public safety fund, it's still in the public safety fund for sheriff to purchase 4 new squads at $200,000. And the $120,000 for joint dispatch salaries, to be transferred over for that. Capital Improvement Fund, 145, the BB&T payment is in there as we can't really not avoid that. It's the $51,802. $20,000 for heat pumps, $25,000 for parking lot, and then we did include the $35,000 for the break room, bathroom, lactation room, whatever's gonna happen with the old Head Start area that is not currently occupied by storage. Salary breakdown, contracts, ask me, is anything under $13 an hour is a 4%. Anything over $13 an hour is a 2.75%. Ask me highway is 2.5. FOP, they have a percentage plus a step. The percentage is 2.5. The ICPHD employee percentage was 4%, and that was decided and voted upon by their Board of Health. Any non-union employee is at a 2.75% increase. County assessor, as it has been in the past, is the same as the elected officials increases. And then the only difference is the finance manager at a 4% increase, which was approved last month, I believe? 2 meetings ago. The insurance I have in there with the current broker and coverage that was quoted at the 9.9%. The general fund revenue side, we're looking at approximately 6 million in revenue, with approximately 6 million going out for expenses. Total budget for revenue side, we're looking at 24,700. For expense side, we're looking at 23,073,000. Yeah, so it looks pretty well in line. The only thing that I would suggest is that maybe take a look at it, review it. I do have to still, with the copy that you have in front of you, I already had them printed off. When Brian had asked to make that adjustment to her automation, it's not going to affect the general budget. And the only other thing that I have is Angel Crawford was going to be here today with Ida to talk about the county contribution to her fund. It currently is in the budget that you have in front of you at 17,500, which is what it was last year. Or I'm sorry, I guess it would be this year, fiscal year 21. I've explained to her, she has sent me over the Ida budget. It does not per se have anything in it as a request from the county. But she did just call a little bit ago. She was unable to make this meeting, and she told me over the phone that what she would want to request is 40,000 from the county. Looking at her budget versus the previous Ida director's budget, it's almost doubled. So I think that's why the ask for the increase in the transfer from the county is there. It's kind of up to you if you want to do that. We'd have to rework some numbers. 40,000 is a big jump from 17.5. And this is something that, we've discussed the last few months, and I have discussed with her the last few months on getting a number. So what I would ask is that no later than Tuesday at the board meeting that this be approved. So it needs to be posted by October 19th in order for the public to view before a final vote.
Okay. One thing, and I know you're new to all this, Sheriff, that if you could help me going forward with the squad cars and the rolling of these and the whole thought process on that, because I'll be frank with you, it's been a little confusing over the years.
As far as the new squad cars and transferring the old ones out?
Yeah, and how this rotation is supposed to happen and how many people are using them, and it gets a little convoluted.
Okay.
And I do have it, and I apologize, I left it in my office, but I was provided a listing of all your vehicles and the mileage on them, and as I recall, none of them are over that 160,000 mark quite yet.
Mine just rolled over 160.
Okay, see, and then I got that a while back, but.
And that's fine. And Deputy Brenner is the one that handles all of our vehicle maintenance, does an excellent job. He knows every car and what's wrong with it and what needs to be replaced. And we're not excessive on the maintenance, but we've got to keep our guys safe.
No, I understand.
And so with the addition of these extra 4 vehicles that we're allowed to purchase, what we're going for is each officer being able to have their own car. What that's going to do is increase the lifespan of those cars. When I first started in 2000, we were hot seating those cars, so I would get off at 6 a.m. Another deputy would come in at 6. The car wouldn't shut off. He'd get in it and take off. We would run 400 and some miles per shift on those squad cars, and the lifespan of those is definitely decreased.
Well, and that would be helpful, so that, I think it'd be good to understand what that longer term plan, like what is the 5-year plan? Okay, so if this gets us to that point, then how many cars do we need each year? I mean, just simply how, I mean, I know that's gonna vary on how many miles you guys
Right,
put on,
is
but.
there are currently 3 that are sharing, like 3 vehicles that are shared?
Correct, I believe so.
Yeah,
yes.
I think that's what it said.
So we got 3 officers that they share with their
Mhm.
car partner. So we have one shift that works Tuesday through Friday, and one shift that works Friday through Monday. So on Fridays, that deputy would go pick up his car partner, and they would ride together, and then gets dropped off at the end of that shift. And then that car partner has it. On the flip side, if you have your own squad car, it's not being driven that extra 3 days a week, which is gonna, lessen the miles and the wear and tear on that vehicle. So, all in all, it is a cost savings to the county. It's a more upfront, but in the long run, it is gonna be definitely a cost savings. So Deputy Brenner is working with different things with the new vehicles as far as adding the cold air intakes that increases the fuel mileage. He was able to get 1 to 2 miles per gallon out of his vehicle, which is going to be a cost savings to the county as well for the fuel. So.
Now, when you have your vehicles, I know we have mileage, but it's kind of you're looking at engine running time probably. Is that something that you guys track?
The hours, I'm sure Deputy Brenner
Okay.
takes that into account.
Yeah, because that would make more sense than mileage per se, because, there are some times where you're
Sure.
gonna be sitting, so.
Now, if you take a vehicle from Watsika PD that's got 70,000 miles on it, or a county vehicle that's got 70,000, that Watsika vehicle, you might as well have 140,000 on it, because there's twice as many turns, twice as many stops, twice as many bumps. Our guys are driving from Watsika to Thawville in one stretch, so that's adding, the mileage to that. Just difference in town versus county.
Hillman car count is one of the 4 for next year, so they're only gonna get 3 new ones.
Well, that was my next question is, so essentially you need 3 to get everybody on their own vehicle.
I think the 4 have been ordered.
They have it.
Right.
Oh, he's getting 5.
Yeah, with that.
Hillman car added in.
This is, so if you could maybe next month bring us like, Dr. Brenner knows all this or whatever, but what is that plan? And
Sure.
It gets a little confusing, especially we don't deal with it every day. So
We've got
what's the 5-year plan on cars and how often do we think we're gonna have to be rotated out
Sure.
and updated?
We do have a couple of spare vehicles, but we use those like one of our trucks is down. It has been for the last 3 to 4 weeks because there was an issue with the computer. So once that truck is down, that deputy's got to have a squad car to be able to use. It's fall, so deer are running. There's a pretty good chance if you drive 400 miles a day, you're going to come in contact with a deer. So, we need to have a spare car there. We've got a Trailblazer that is kind of nearing the end of its lifespan. We've sunk some money into that. So that would be one that Deputy Brenner would say, yes, that needs to be rotated out of the fleet. So, but I'll bring all that information to you. And
That'd be good. Thank you.
If you wanna talk about Ida, I can maybe help some information on it.
Okay.
Well, I have some too, because she emailed me her budget, and basically where a lot of the extra expenses are coming in is she's looking to hire out a grant manager, as well as redoing some of their IT and website advertising.
But none of that's been approved by the Ida board yet.
No.
And hire a grant manager?
Mhm. And hire a, what is this at? Give me
Are
that.
you on the Ida board?
Yeah.
And Jill is taking the minutes for the Ida meetings now. How she got roped into that, I really don't know.
Yeah, you just add that to my door, my title on my door.
The county has historically you know, I say historically, for as long as I've been around, and before that, given $25,000 a year to IDA. Last year, because of the concerns over COVID and possible losses of revenue, I suggested that we reduce that to 17.5. And I think, in my mind, the question before us this year, should we stay at 17.5 or should we go back to the 25 that we have provided historically? I think if you look at the other members of IDA and their contributions, they're all quite a bit less in terms of dollars and cents. As far, I didn't bring the financial data for IDA with me today, but I know they've got a pretty good bank balance. I'm not really sure that they're hurting for money at the moment.
I personally feel like we should leave it at 17.5, and, I mean, let's not jump into a huge budget when she's just jumping into the position and,
I think, to me, it's, if we wanna go back to where we were before, because they didn't object when we reduced down to 17.5 because of concerns over COVID, so I mean, I think you can justify going back to 25 if you want. You can leave it at 17.5 as well. Angel has a lot of ideas. She's also new to the job. She's gonna, you know, she's gonna experience a few bumps along the road as well.
Part-time assistant as well
The way IDA was been operated, when Ken Beardsley was there, he was only working half a day. So
this phone call on that,
so is she working all, is she working?
my understanding is she's supposed to be working a half a day also.
Oh, half a day also?
Now, there may be some days you don't work and you work a whole day the next
Yeah.
day. You're supposed to have a job.
That's fine, but,
Half a day.
you know, I guess that's a very ambitious.
It's very ambitious.
And I don't fault that, but at the same time, coming off of COVID and everything else, I think that she's gonna have to do that baby steps because
Well,
just
and
getting back.
keep in mind too, if we were to even go to 25,000, that puts us in the red
Right, yeah.
for the general.
I'm just providing information.
And the one thing that
I'm
I'm
not-
concerned with, and it's nothing personal towards Angel, and I understand this is her first year and she's new and all that, but, you know, we've asked several times for just like I do from every department, all I needed was email it to me, a number of what you would like us to discuss as the transfer amount. And that's where I would agree with Sherry, as we leave it as a 17.5, because it has been asked for a few months now.
Right.
Well, I understand.
And
that
again,
part.
nothing personal, she's
No,
new, I get it.
I'm not making excuses for her, other than I know she's,
I'm
I have
strictly
an awful
looking at-
lot on her plate, just getting her feet on the
Yeah.
ground, getting
Yeah.
familiar with
Yeah.
everything.
I'm strictly looking at the budget.
I see text
Numbers.
messages from her almost daily to Ken Bergery asking him, where is this at, where is that, and I can't find this, kind of thing.
No, and I totally get that, cause I was kind of put in the similar situation, but just speaking for me and looking at the numbers, I've asked for several months just for her to shoot me a number or an idea, and if we were to change something at this point, it's gonna put the general in the red.
Well, and really where we're at right now, in October, you know, really we're only talking months until the next budget proposal comes out.
Right.
Which gives her plenty of time to get all of those things lined up and actual details and stuff like that. So I don't think that that's unfair to say, no, we're not gonna do it this year, but we'll be happy to entertain increasing
Right,
it
for
next year.
next year when she's had a little more time to sink in.
Right.
But I'm just looking at the numbers aspect, and if you were to agree to increase that today, then it's gonna put us in the red. And we're talking that we need to have this posted for public viewing by October 19th.
I'm not.
I know, you're just giving the
recommending anything.
details.
I'm just trying to.
Giving the
help
details, I
community
get it.
Understand
I get it.
what the history is.
So again, my suggestion is if any changes were going to be asked, that they be asked today so that this can be presented at the board for a motion to accept the tentative budget for posting.
I think it's one of the things though that we as a board probably should be reviewing going forward as to our commitment to IDM, what we, because we were, I don't know how many years we gave 25,000, like I said, ever since I've been here, it was that much, so.
When was the last time Ida was here and talked to us about the
She came 2-3 weeks ago, or, well,
2 or 3 months ago?
2 or 3 months ago, after she first started. but-
She's come to the board meetings and she's also come to a number of the committee meetings,
Yeah.
specifically that she's come to the tax committee meetings. Not sure if she's come to any others besides tax.
Okay, but can I send the motion if you want to? If that makes
What was
sense.
it? Sorry, Sherry. Or
You better
Donna,
say
go
it.
ahead.
Are you done with your, I wanna ask a question on another topic, and I don't wanna.
You got a motion then?
Well, actually, I had just said that I thought for this year, since we're so close to the end and really getting ready to start a new budget, that we should keep it at the 17.5 for this year. And as then she'll have time to detail more what she wants to do and everything else and can present it to us again for an increase next year. That's what I said. And I can make that as a motion if that makes life easier for everybody. You tell me.
I don't know that we need a motion, we just leave the budget alone, huh?
Yeah, I would just say maybe the motion should be something along the lines of accepting this budget with the changes proposed and have, or just move it to the county board for approval. That would be fine, because in this current budget that I have now, I do not have Brian's request, as I already had this printed out when the change was requested, but it doesn't affect the general, it's her automation. So perhaps making a motion to let the
Include
county
that.
board
Yeah.
vote on
One
approval.
other thing though, do we need to talk about this, the joint dispatch thing, before we get to that?
Well, the numbers aren't gonna change from joint dispatch, it's just gonna be how they
How we
bill
collect
it.
All right, well then I'll make the motion.
We still need to talk about it, though.
Okay.
Right,
I'll make the
but-
motion that we send the budget as presented to the full board with Brienne's change to her automation fund
Second.
included in that. Seconded by Sherry. And if there's no more discussion or
All right, you're getting it all in.
Make it up for us.
Donna, were you saying, sorry.
Before you make that
Oh.
motion, I have a question,
Okay.
please. Has the committee given any thought to, what I asked about, setting aside any of the public safety money annually? Has that been addressed?
We haven't, no, but we,
Since it's its own fund, anything that's not used is basically still sitting in that fund.
I think the point, I think your point's valid, that if we need to have a longer term vision of what we're actually gonna use this money for and those kind of things, I think is a valid point. I don't know that actually impacts the budget as it's presented right now, but I think we do need to probably make that an agenda item that we establish that as this is what.
It doesn't like the general.
I don't know that it's gonna affect us getting the budget passed is what I'm getting at, but it probably, we do need to have more thought about that and discussion
And
a vision of that.
talked to some of you about that it would be a shame if at the end of 10 years or sometime down the road that we have spent every penny of that public safety tax money without a vision towards setting some of that aside annually for things to come. Of course, my thought is specifically a jail, we don't know that, but there would be other things, and I would really like to see the finance committee address that.
Agreed. I agree with you. I think can we put that on the agenda for next month? I mean, I don't know that that affects this budget right now at this point in time. I think we can pass or send the budget on to the board, but let's put it on the agenda for next month and going forward. And I guess with that being said, Sheriff, this is something we've been talking about, ETSB as well, that to Donna's point, it's been kind of used as a cover all the things that we couldn't cover in the general fund thing, and to Donna's point, I guess a lot of us feel like maybe that doesn't make a lot of sense, and we've been doing it because it seems like we're always chasing our tail, but maybe we need to have a vision that, okay, for ongoing week to week or year to year expenses and things like that, okay, we buy the car from Gilman or whatever, fine. They're having some money for doing those type of things is fine, but maybe we need to be taking, and I don't know what the numbers are, but we need to take half of the money that we pull in every year on that tax and set it aside for, I don't know what.
The general fund.
I definitely agree. I think once that tax was passed, we needed to wait till that generated some decent amounts before we were to start pulling off of that and using it for what it was billed to the taxpayers for. But yeah, I think we should definitely need to have some discussion on what we'll need going forward 5, 10, 20, 50 years. As far as new jail or improvements, stuff like that.
Right. And how much or whatever, I guess we probably need to, probably just need to have more discussions about it. I don't know what the right answer is, but it probably warrants having discussions. But given our situation today and how long this meeting's already gone, we'll push that off to next month again. But, so we have a motion to send the budget to the full board for approval, including Brienne's adjustment to her automation fund, and we have a second. Any more discussion? If not, we'll call the roll and vote.
Alt?
Yes.
Bowers?
Yes.
Curtis?
Yes.
Johnson? Young?
Yes.
McTaggart?
Yes. Okay, claims. That's the one I got in my email. All right.
Sure.
I got one right here.
Anything weird looking?
Pretty standard. And the thing I do want to make a note on is, we are going to close Fund 140, which I've talked about for about a year now. It is the old county information fund. Everything runs through finance now. As far as IT goes, there is some money left in that fund, so the down payment for the phone system going in at the courthouse, I went ahead and utilized those funds for that.
All right. We got a motion to approve the claims. Joe, second. Paul, any other questions? We'll call the roll.
Alt?
Yes.
Bowers?
Yes.
Curtis?
Yes.
Johnson?
Yes.
Young?
Yes.
McTaggart?
Yes. Okay, finished with that. Old business. No, John, we're, we're over the time limit. Go ahead.
When we were talking about the contract with Gilman for law enforcement, I think it wasn't brought up a little bit ago, but the contract does not include any money for ICOM. And I said at the last finance committee meeting that I would support the contract with Gilman if we, as a board, to develop a better and newer way of funding ICOM, joint dispatch. To that end, Lyle Behrens and I have met with Eric Raymond, and Charlie Alt was at the last meeting. One of the things that we were looking at is on a piece of paper that was given to you. It's something that we thought might be a fairer way of having the agencies in the county make a contribution. And looking at that piece of paper, one thing stands out, and that's the Milford Police Department. And looking at that, one would suppose that there's a huge crime wave in the city of Milford. They're getting over more than 3 calls for service every day of the year. I'm not sure that that's correct.
Chairman, I can maybe speak to that.
Go ahead.
And I spoke with Eric prior to the meeting. This number, this calls, is 1,261. That's not necessarily calls for service. That's every time Milford picks up their radio and says, ICOM, I've got a traffic stop, or ICOM, I'll be out here for an ordinance violation. Or it could be a 911 call. So the fact that they have 1,261 times they've contacted dispatch, it just means that they're quite active. If Watsika's numbers were in here, you would see a very large number for Watsika. So that doesn't necessarily mean that it's a crime.
Watsika also contributes a large amount of money.
Sure. But just for number wise, you can see a large number for Watsika.
So how can we adjust that then, I guess would be the question. I can get together with Mr. Raymond and see if we can get that fine tuned then, but basically what we're trying to do is to develop a plan where we might charge the different agencies on a basis of how many calls for service they have. It hasn't been just Gilman that was complaining about it. The Crescent Iroquois EMS has complained about it. Sawville, Fort Iroquois Fire has complained about it. Gilman Fire. I don't think there's anybody on the list that hasn't complained about it or asked about it. Amanda is the one that administers it along with myself, and we need a better system. That's what I said at the last meeting, and what you're looking at is evidence of what we're working on. The totals are still gonna stay the same as far as budget is concerned. But I wanna give you all that information so you know what we're trying to get accomplished. And maybe by the time we meet again next month, we'll have something better to report as to how we wanna proceed, because we need to get something in place in order to get our invoices sent out for the coming year and so forth, so.
I have a question, like on Sister Park, if we get dispatched to an accident, we're gonna roll our ambulance. It's part of the fire department, it's not separate like Crescent City.
No, you get billed separate. System Park, System Park.
So what you're
EMS
telling
gets
me
a
is we
separate
had
bill.
75 fires last year?
That's correct.
No.
Well,
Can't be.
fire calls.
You must have us down every time we respond to an accident, as well as the fires, and then the ambulance counts as well. So do we pay $20 or do we pay $10, $9, whatever, to get sent to an accident scene?
Well, when your System Park itself is being paged, it's System Park Fire and EMS. So, yes, in the essentials, you're going to get billed double on a car accident because the EMS is rolling and the fire department is
But it's
rolling.
one agency is my point.
But you've always been billed separately is the question. Now, this can be amended or at least looked into, but
If we reduce the number of calls for service, then the cost per call will go up.
Yeah, I understand all that, I think it just needs to be clarified.
Well, and that's part of what we're trying to get accomplished here, and to your point, Joe, I think that's very worthwhile. I think we need to get those kinds of things worked out, because, you know, the system that we have right now was a patchwork thing when it began, and it's been allowed to continue on. It's not, and there is no perfect plan, I don't think, that's gonna be covering everything that accurately, but I know we can do a better job, and that's what we're trying to get accomplished.
So is there a way, like, I mean, I guess I have no clue how this stuff works, but if that's every time they say, hey, I pulled somebody over for blowing through it, I mean, like, can we do it by actual, like, 911 incident, or, I don't,
Well, I mean, we could potentially do it by 911 incident, but we don't do a call just based on a 911 incident. We still have to, whatever police officer or deputy goes and conducts a traffic stop is still work for us. It's work on the dispatchers. There's safety checks. There's running license plates, driver's licenses, potential in there. The safety check, again, I'm going to stress this one, because when they're out on that road, they don't know what they're getting until they walk up to that door, and even sometimes, they don't even know that. They can have calls that go south very quickly. We're there to listen to that and get them the help when they need it. So to pull out a traffic stop is still work that's being done on the dispatch's behalf.
okay.
Did you base this off 1 year?
This is based only off of 1 year.
So would it not be better to base it off of 3 years and take an average?
You can do that. You can do 3 to 5 years. The reason why I did it this way, because if you have small, writing's kind of small, it is based on a report from 7/1 through 6/30 of 21. This was done purposefully. If we're going to move to this type of billing, my suggestion would be that you would kind of look at it pretty much 6 months in lieu. If we base it on an average, that number can grow significantly and you'd have potentially less volume. So let's pick on Milford again, since they do have very large numbers. So let's pretend that over the next 2 years, they maybe run half those calls. Departments changed, they got a different direction, whatever. If we use an average, you're gonna have a lot more calls that they're gonna be paying for an average. So next year, if we use the same method, now instead of 1,800 divided by 2, so 900, if they only ran 600, they would have had the opportunity to only be billed based on that 600. So there is an opportunity for them to have some savings in there as well. Now, Chairman Schur has already mentioned that this is not going to be a perfect process. There probably will be some heartache, and there's definitely going to be some very different questions asked moving into this.
What are these people paying now? Is it drastically different, I assume? On all of them?
Milford, for example, is paying, what, almost a little over 4,000 for
Yeah.
2 officers?
Yeah, it's less than 5.
They'd be paying 12.
Is there, I mean, I don't know, maybe you have experience working in other departments, but how does, why can't we just charge a fee every time there's, I mean, just bill them?
Well, who's gonna do that bookkeeping?
I don't know, if we got
I
these
wanna
numbers,
say
some of them
it-
bill at the end of the year, I don't know. Can't be that, if we came up with this, we could come up,
I wanna say as to Milford's numbers, I think there was something going on in Milford. A lot of people had the,
apparently, Donna.
No. Wait a minute, local people have the direct 417 police officer's number in Milford. And we didn't even go through 911, we just called them direct and said, hey, you know, can you come over and talk to me about my kid's bike got stolen, these little things. So I don't know how many of those calls went on, but lately there's been a change in Milford, and that's no longer allowed. You're not allowed to call the officer on duty direct on the cell phone, you have to go through 911. So that could be part of what was going on in Milford. I don't know how big a part, how little a part, but I know it was going on.
Let me add to that, because most of the time, that phone call to either police officer, ICON, I'm out at. And it doesn't matter if you call the officer directly over to you, they're telling us they are there, we're gonna create a log for that.
But you didn't get the call from me to say, hey, my kid's bicycle
I
got
call
stolen.
There's a lot of people on there that
This
are paying
is
a lot
true,
less.
and a lot of that also comes to accurate representation, you're
They're
doing.
gonna be able to
President wants to, so on and so forth, I mean, there's a lot of stuff that
It just seems like you could have
a
maybe that makes it more complicated, but look, every time you got a call, it's $10, I don't know, whatever, and then,
That's kind of what this is doing.
what? Yeah.
Where did this 45,693 number come from? That's just.
He added up the calls,
Oh,
the calls.
No, the total dollar
First day
amount.
with all these
oh, okay.
agencies. No, this is in the budget.
And no one could, that's just, because nothing makes sense in this whole joint dispatch stuff. For some reason,
In the budget for funding joint dispatch, we got the county that's giving 120,000, Waukesha is 120,000, ETSP is 120, whatever the numbers are. Public safety is giving them what, and what's left over. And Riverside, we have a separate contract with them, so you take all those numbers, and the total cost for running just the dispatchers is $650,000 some dollars every year. So you divide, you subtract those numbers out of it, we'll take this to 45, 693.
And that's
Yeah, I
these
mean,
numbers.
That's what these numbers
Every
are.
year they bid, every year.
We should deduct it from.
I guess when they, this money, now the county can decide, we're gonna pay all of this, or we can take it all out of public safety.
Hey, listen,
But this was
I can't
intended
count
that
it.
everybody has a participation in
I'm
it.
the chairman of
Maybe
each
years that he
CSB.
doesn't do any
And I was, he was talking again about,
Woodland Fire.
Pigeon Grove Township.
It's against the plan. Hey, believe it or not, it's against the rules.
Yellen would be a,
He won't, he has made
Douglas
it clear that he
Township.
does not manage the joint dispatch.
Yeah,
I mean,
seriously.
I don't know if that's a fair way,
That's
I don't know.
I could have said some more things.
all the numbers are very arbitrary. That's why it's like, why does the county pay 120,000? No one knows. It's just like, this just was born out of
What needs to be done, in my opinion,
a convoluted
some research needs to be
mess.
done on what other towns are charging.
I would like to
There's
see,
gotta be a better
can I
system,
get those
because I can
numbers,
tell you right now,
how
nobody's
much
not gonna be
everybody pays on one sheet?
They're just not gonna pay it, and then we're gonna be, what, taking it out of public safety again?
Just so I can.
I forgot about it.
What?
Could I get the numbers on how much the county pays and what Zika pays and like Sheldon PD and Oregon?
Yeah, we can get that to you. Yeah.
Just so I've got a better understanding, so I can
I
recommend.
thought I was getting nominated for something.
Yep.
One thing, if you're gonna charge, Milford PD
Fees to.
$9.86 every time they pick up the radio, they're gonna quit picking up the radio, is an issue. When they get out for an ordinance violation, they're telling dispatch, hey, I'm gonna get out here, you know, this guy may have a gun, I don't know. But if Milford PD doesn't call out and say, I'm here, and they get shot, it's an issue. And if they're paying, $9.86
Right
every
now,
time
they're
they pick
paying
up the
about,
radio.
right now, they're paying close to 4,500 a year.
It's an officer safety issue, because they're gonna quit calling dispatch, so.
How do they do this in like, I guess, whatever.
Anywhere else.
I mean, how do they determine, like, the Momentum Police Department, if they do that? I mean, where do they come up with that number? Because this, my handful of years looking at this, it makes no sense.
Well, that's why I was just
Right, because there's gotta, the problem is that everyone's gonna complain no matter what.
What was the way to do it?
Eric said they're based on calls for service.
I talked to their former fire chief for Kankakee Fire, and he was, I think he said he was close to number one or number two in their billing as far as fee for service. There's other things at play as well, similar to other contracts. So like we have a Riverside contract, that's not in or a part of this. So there's already a set designated number that's going into the joint dispatch budget for that.
Right.
So other areas, Chairman Sure has mentioned sitting in Livingston County when the village of Chatsworth wanted to do have dispatching done by Livingston County, and they said, if you want that done, it's $18,000. Some of them can do a flat. I mean, we need to do what's best for us, and what everybody else is doing does have its opportunities to help weigh in on something like this. As it is today, essentially the number started as an arbitrary number. So there's 45,000 combined between the police, fire, and EMS fees. It started as an arbitrary number to begin with. So arbitrarily, we could change it to something else. And all I've been doing over the last few years, we came up to a number, and I've just been adding the 5% because that's what the employees are getting as their salary increases.
Yeah, that's the problem. There's how these numbers were developed to begin with. Maybe there was more logic than it looks like in hindsight, but it's hard to follow it if there is, because.
Well,
Yeah, and however we, and it also gets back to, the fact that the state has mandated that we have joint dispatch, but their idea is funding it through the telephone surcharge. And that's not enough money to cover the cost of it.
But the thing is, yeah, initially it was on landlines, but now everybody's got a cell phone. So
They're still paying,
honestly,
they're
that
still paying
hasn't
$1.50.
gone down. It's probably gone up because, like in my house, we've got 4 phones. We don't have a landline, but that's 3 extra phones that you're still getting charged that fee on.
You should be
each cell
paying
phone.
$6.
The problem is, we have $200,000 radio systems we gotta buy every 4th year.
Yeah.
And, we are a small county.
Yeah.
I mean, we don't have enough people to justify the overhead.
Well, I would say this, as far as the ATSB's budget, you have it in front of you in there. We're putting in roughly, this year, we're putting in more than half of the surcharge money that we're getting into the joint dispatch. The rest of that is to maintain and upkeep the system. So, I mean, as Chairman Sure just identified, there's not enough surcharge money in there for the ATSB to be able to go in to take care of the employees. The employees are over $600,000, and we're already to a point that we're only getting about $540,000 in surcharge money.
Donna, you had something?
yeah, I just wanted, in a previous meeting, Mr. Shore had said that, maybe the way to go is to go to townships, which I'm just gonna say from a historical perspective, that was suggested, I think, in the beginning and shot down by this county board and another chairman. But the other thing, another perspective to this is that, for instance, Milford pays police, fire, and their ambulance is billed separately. Now, Stockton no longer has an ambulance, so Milford's going to Stockton covering their ambulance calls. So then that's gonna be an increase. I think the Stockton Fire Department pays, but I don't know if the ambulance was part of that, but that would account for, there's gonna be an increase in their ambulance calls, no doubt. And these are the little nuances that may get overlooked in the analysis of this situation.
Right.
Does Milford Ambulance charge a fee to somebody when they respond to a call for service?
Milford Ambulance bills insurance and charges a fee, but Milford Ambulance is not on the tax bills at all. Milford Ambulance is solely supported by private donation in Milford.
I believe Crescent Point is a similar.
And I still would have more.
I'm not aware of how
I
that
hope they
is
pay
set
their
up.
bills so you get covered there. Probably not.
Well,
Yes.
suffice it to say, it's a real can of worms. We're not gonna get anything done today, but anybody who has ideas, please communicate them to me. And we can
I
hopefully
think
work
part
towards a
of the biggest struggle is gonna be the precedence, which was really founded on, I could be wrong, maybe I'm not giving the people before us enough credit, but it doesn't appear like there's a whole lot of logic on why 45 grand is cut for all these people and 120 grand for the county and 120 grand for Watsika. Maybe there was some really sound logic when those numbers were come up with, but in 10, 15 years down the road, it's hard to follow where that came from and why.
I need to find that napkin that the notes.
Yeah, there might have been, yeah.
Yeah, it was the biggest users, paid the biggest.
Yeah, but it's not a third.
Well,
That's what I thought it started out as.
yeah,
But it's far from it, yeah.
because, Watsika gave up their dispatch to come with us. They gave up their radio. They have their separate building
Sure.
up there with their own
Sure.
dispatcher and radio system. And then the county, and then who's the third? Oh, joint dispatch.
The ETSB
So
is the
so
other.
did Milford at one point in time. If you, in Milford, if you called someplace in Milford if you had a fire or The
We
police
call
and.
directly the
ETSB,
police
the
department.
county,
So
and,
you don't have that.
and Watsika pay about a third, but then you also have this extra 45,000 plus the 35,000 from Riverside. I don't know how those, I mean,
I would like to just see all the numbers.
I don't even know
from
that
me
it's-
At one point, so that would help me.
And in fact, John, we just had that conversation because we've got three field fires and 2 combines, and one went up really fast. And what is being talked about a lot is farmers are in fields where they don't know coordinates. You know, they're down at the Miller place on the Miller 80. And so this happened to a farmer who was quite shook up and was probably lucky to get out of his combine when they're asking at 911 for coordinates. And they are going out and they are figuring out what they are and placarding them in their combines and their tractors. I've heard several say that. But back in the day when we called the fire department directly and our grain truck was on fire because of a break, and I called and said, at Harold Crow's farm that used the second driveway by the tool shed. That doesn't work anymore, you know.
But if you had somebody in Milford that answered their phone, that was a cost to Milford.
Well, sure. But usually, you know, it was the secretary. Sorry.
Okay.
You know, at the implement store. So.
Long story short, we need to get it figured out. We will continue that next month. Everyone can come back with their brilliant ideas about it. All right, any other old or new business? If not, need a motion to adjourn.
Yeah, so moved.
Seconded by Sherry, get her name in the books again, and all in favor? Aye.
Do you want me to leave this? You're gonna.
It's up to you, I have a copy of the phone. Okay. If you want.